All right, Brandon Lamb. You're about to be triggered.
Man, I don't know. We're coming hard tonight. Yeah,
I was hard when I got here.
Yeah, yeah. That sounded exactly how I intended it to be. Welcome back, Hell to Play. We're gonna jump right in. We got on the line Dr. Bobby Ice from somewhere overseas or over some kind of sea. I don't know. I mean, do we need to
put a little
over here?
If shit starts to pop off, we might go live to a childbirth at some point today.
Oh my God, there's so much going on right now.
This is it's a heavy day today. We got a lot going on.
Yeah. I'm so nervous. There's so much going on. This is we have a clusterfuck of cords in front of my face right now, but I think we're all good. We'll probably kick this in at some different time, but I don't know. Where do we begin, fellas? We got a nice town hall meeting going here.
Yeah, I mean, I think, Bobby Ice got a lot to say, so I think we let him take it away to begin with.
All right.
So, Bobby Ice, why don't you just give a quick 1 minute on who you are and what you do?
Okay. Well, first of all, thanks for having me on Hells to Play. I've listened to a lot of the podcasts, and some of the Aaron Rodgers comments really had me cracking up.
Yeah, fuck him.
Smoking Jay with talent.
Oh yeah.
But let's see, who am I? So I'm a second-year resident, family medicine, at an undisclosed location, just because I'm going to be hating hard on basically everything healthcare related. Don't want to get fired. Let's see. So I grew up in Illinois. My brother Evan, he's with y'all. Man, I don't know. I just got done cooking some wings. Went on a nice little hike. Found out. So on the on the shower, how there's different settings. You got the high flow that you never use.
Oh yeah, I thought you were gonna say hot and cold.
No, man. So after hiking, you got to do a deep clean. First time ever activated the high flow and just went straight for the crack. Cleaned it right out. So now you know. Now the world knows.
Medical term for that is an enema, I believe.
I'm going to kindly ask you to prove it, as this is audio only, so go ahead. We'll do an inspection. All right, so you've been making discoveries basically nonstop. The work you don't leave, you bring work home. It doesn't stop at the office.
Yeah, so pretty much.
Hit us with some truth. What's going on behind the scenes that us lay people don't know?
Well, I mean, I guess we'll just get the whole COVID thing out of the way, since that's a big hitter right now. So I was actually in the ED in the emergency department on a rotation when kind of everything started. And so, everyone's freaking out. They actually sent me home for a day because they didn't want me using the PPD, which is personal protective equipment. And basically just nobody came to the ER. Probably half as many as normal. But of course, half the people that come into the ER don't need to be there at all. So it was kind of an eerie situation, and we're believing the hype. This thing's gonna rock us, and then just it you'd have a couple cases here and there, and it didn't happen, which we clearly know. But it's just And so now, when you go into the hospital, they're handing everybody a mask, and then you're supposed to wear your mask all day, and it's just ludicrous. And it's just it's even in the hospital, it's just a propaganda machine.
Is that
So
sentiment shared with a lot of your coworkers?
uh, I mean, you got the people that still like want to do. I don't know. Yeah, pretty much. But no one wants to say it out loud. Um, yeah, and so the city held like a we're here so you can stay home. Our healthcare workers are the best people ever, and so they put on a parade. And they sent us all an email in an email like, "Hey, there's this parade. Go outside, and make sure you wear your mask." And it was just like, why are we wearing masks outside? And why are we all like huddled together wearing our masks just for publicity? So I just walked right by it and just went home. I couldn't be a part of the propaganda machine.
You just took your mask and ball and glove and went home.
Yeah, no, I walked right by the camera crews and just got in my car and drove home. And I actually saw like the parade pulling out as I drove by on the road.
Did you get any
So,
bite-sized Reese's candies?
oh man,
I heard that's hero. That's hero fuel right there.
That's true. I am also a declared hero, being a essential employee.
uh,
But if we, I mean, I can elaborate on that. We'll get to that. But
Go back to it, yeah.
But so is this like that? I mean, they had a parade for you guys. Is just your hospital? Healthcare workers all over your city? I mean, how you don't have to tell us where you're at, obviously, but like, how big of a city is this?
it's about, I want to say like 150,000, but we probably service like a million, maybe like 500,000.
So
I mean, it's a big hospital.
and the parade was obviously nobody was in attendance for the parade because why would they encourage people to fucking be right? I mean,
Well, I mean they did encourage they encouraged us to, which is extremely odd for them to give you like time off to go do something, but they want us to take time off and go to the street and congregate for publicity, which and then they so Trump declared like the flyover or whatever. So for like an hour, there was probably 300 people, like employees, on the top of the parking deck, just waiting for these F-16s to come by. So we're all sitting there for like an hour waiting for them. I mean, who knows how many thousands of dollars that is? Like $50,000. And then and then they just come by going slow as ever, and like didn't even hit the afterburners or anything. And it was just the lamest thing ever.
So what were the thousands of people that were apparently on their deathbed? What were they doing while you guys were out on?
yeah. So the hospital is max capacity.
Yeah, obviously we
yeah,
just got people
we're-
falling over each
yeah.
other, sharing beds. I mean, what are they doing while you guys are up on that roof waiting for this flyover?
They're sitting there coughing, and I mean, so we were at like 60% capacity. So get this. So 60% capacity for about a week. So after the ER, I switched to inpatient service, and we were designated to not deal with any COVID patients because we were residents, young. They didn't want us doing that. So about 2 weeks in, when the census, the hospital's at about 60%, and we were supposed to peak like April 20th. So this is about 2 weeks or a week and a half after that. No peak. And then we started getting these admissions from the ER of things that would never get admitted. So let's see. You got someone with a potassium level of like I don't know, 5.1, which is, people are, the range is like 3.5 to 4.6. And so and they're admitting these old patients that are at risk for reasons that normally they would never be in the hospital for, just to get the census up, to get the hospital money.
Holy fuck.
So somebody comes in with a high potassium level. Instead of telling them to stop eating bananas, next thing they know, they're intubated, and they're and they die.
Yeah.
And now they die of corona.
I mean,
Like, Doc, I don't know what to do. My shit is floating. Like, you wouldn't believe. What am I supposed to do to get these things to sink?
Let's get this guy a goddamn tube down his throat.
Yeah.
Stat.
Yeah. Obviously, you can't breathe yourself. Let's go.
It's just and I think maybe just now they're starting to let families in there, but I mean, you got people basically dying alone because they're not letting families be in the room with them. It's just extremely sad that, and it doesn't, like, clearly now it doesn't need to be like that. It didn't need to be like that a month ago. So I'm just really irritated with the whole thing, to be honest.
But that's like one of the most brutal things is not only hospitals, but nursing homes and stuff, where these people are trying to like ride out the golden years. How many, like you just said, how many people are just dying alone based on this and what we were kind of chatting about
At the pre-pod.
Yeah, with the pre-pod.
The non-recorded pre-pod.
On the other side of the vault door here. How many of these elderly people, and I'll just double down, let's say 80 plus, because they said 80, people in their 80s, of course, are going to be affected by this, as they would be affected by almost anything.
Right.
But how many of them would want you to put your freedom and liberty on the line on their behalf? Like, would you fuckers settle down? Like, I'm trying to enjoy retirement here. Like, that doesn't make any sense. Like, who would do that? Why would your great-grandfather tell you to give up all your freedom for them, like, to protect them? Like, that's what doesn't really make sense to me. Do you know what I'm saying? Like, why does that make sense?
Yeah, when these people have very little life left, and now they're just living it in the solitude, so they didn't even get to enjoy that time. So by trying to protect these elderly people, we're actually just making them suffer and die alone. Like,
pretty much, yeah.
Have you witnessed?
Yeah.
What was the mortality rate at your hospital?
So funny. So we had, I don't know, after our supposed surge. So we have 2 floors that are basically isolated where all the COVID patients are. So I've never been on those floors at all, but the infectious disease doctor sent out a list of everyone that's had it, diagnosed, and then the fatalities. So, this is a good month ago, but we had, I think, 6 total. 3 of them had cancer. And one was on dialysis, and I want to say like 4 of them were older than 70. So, like, from just that, this is not nearly as bad as the flu.
Do you?
Yeah, when I saw that, I was pretty amazed.
Do you think that, like, because obviously something happened in New York, like there is like shit is hitting the fan in New York, right? I mean, is that something different? What do you think is going on there? But I guess even there or whatever, I guess that's my question for you. Like, what do you think is going on in New York City? Because that seems to be the epicenter of everything that's like really happening in America. Like, that's undisputable that something popped off in New York, but
yeah,
we're all now being meant to respond as if that's happening in everywhere.
So, I mean, to be honest, I don't I don't know how bad it is in New York. I'm not gonna believe any numbers that come out, any news reports. I mean, as you clearly probably know now, they're diagnosing anything and everything as COVID, because then the hospital gets more money from the government to fight this terrible thing. But yeah, and then one of the things I read was that they were sending COVID positive patients back to nursing homes.
Yeah, Cuomo is just killing old people. Yeah, that's real.
Yeah, so that'll definitely do it.
Essentially,
Yeah.
a
Finally just
suicide
stopped.
bomber, like just
Yeah, pretty much.
Well, what the fuck's the
Yeah.
difference? I mean,
Yeah, he did that. He started that in late April, and he got so much backlash from it, he had to stop. But it was, I mean, this guy that could do no wrong in everybody's eyes he was basically just sending in secret agents to kill all these old people. And the backlash, the people hanging banners that said off of interstates that said Cuomo killed my grandparents.
that is.
And he
fucked.
finally backed off on it. But it was like, the damage is already done. If it's supposed to spread like wildfire, all it takes is one.
Yeah. Well, and I think this needs to be a wake up call for anybody in a big city. Like, if there's going to be a pandemic, you're going to die. We as humans, we're not supposed to live stacked, 200 stories high, no trees. Just, I don't know how people do it, but
Yeah, I've heard pollution. Pollution is a big, like, the more pollution you have, the more that this carries. It actually, like normally, like in a saliva droplet, it's supposed to, it only goes like 3 feet, but then it can actually get encapsulated in like pollution somehow.
Did Greta say that?
yeah.
Fucking Greta. Yeah. No, but so that I have heard, like, that's why that's kind of what, like, flu. I won't go into it, but that's kind of why the flu, quote unquote, flu season we have, when it always pops up, is something coming from the soil. Whatever. I don't know enough about it to really talk about it, but it's no different than if you think about if we dropped a bomb in the middle of New York City, or we dropped a bomb in the middle of Jefferson County. The death rate is going to be a little bit higher in New York City, and it's just like you said, people living stacked on each other. It's gonna lead to unhealthy conditions.
Yeah. As far as why New York, I don't know. I mean, I know there's also different strains, so maybe something just popped off there.
Well, I mean, hold on, Dr. Ice. Zach had a question for you.
No, I just had a question. I've been curious about something as far as with the hospitals being basically blocked off from the outside world. Like you said, no visitors allowed in and stuff. In your opinion, as far as the leeway between the media and corresponding with hospitals, and I mean, are the hospitals basically free to make up kind of any story they want, and there's no way to check what's true and what's not? I seen a news report, I think it was a Cherry Hill Hospital. They did that fake news story with CBS where they had a bunch of hospital staff lining up to get tested, and then CBS was doing the news report on it, and they did it on purpose to make it look like there was long lines. So do you think there's a lot of that going on in these hospitals because there's really no checks and balances, because they're kind of shutting the doors off to everybody who could kind of expose what's going on?
Yeah. So, I think the parade example was what kind of confirmed it for me. There's definitely this, we're supposed to
Sell it.
show this. Yeah, we're supposed to sell it. We're and it's in as far as like, we're not gonna go out and say we've only had 6 deaths. That's information that should be public. Guys, this is not a big deal.
Right. But even with like the USS Comfort, is that what it was called? The Comfort, the big ass naval ship? Like, didn't they take in 157 people or something after it was there for a couple weeks? And like there was this huge spectacle, much like a parade, and then it leaves with no fucking.
And were they in New York?
Yeah, it was like in the river, or harbor, or wherever.
Yeah. So it makes you think. Is this a big deal in New York? I don't know. Like,
I
whenever
might
I
have.
go to Chicago, everything is times 4 exaggerated. So you can't, we got the best city ever, the bean. So
we got the best fucking pandemic you've ever seen in your life.
The same.
Yeah, the bean. Everybody's been talking about their beans. Yeah. So I have a friend that lives in New York, and I was talking to him as this all came about, and he was laughing, and he lives in like Bed-Stuy, but he was saying when the USS Comfort came in, it was a bit ironic that a crowd actually gathered to watch the ship come in. So people were, like, you're not helping by, like, everybody wants to go and congregate and see the big ass ship that's coming in. It's like, no, you guys are supposed to get the fuck out of here. Like, this is exactly what we're trying to avoid, but that's what happens in these big cities. So I guess that's what you were to what you were saying before, is like, that's just what happens when, like you said, you're living in a building, 200 floors, and what's also weird about that is how many of those people really interact or talk with their neighbors. I mean, you're so physically close to so many people, but at the same time, everybody's got their guard up because you're almost worried about everything. And I'm speaking from zero experience, as I've only lived in small towns my entire life. So take that for what it's worth. But
did the USS Comfort leave?
Yeah, it left.
Loaded with satanic pedophiles for Gitmo?
Either
that's
that
confirmed.
or all the rescued children from the tunnels, from darkness into light.
Okay.
Yeah, from Central Park.
Yeah. Yeah. One of those, yeah.
Dr. Ice, so have you talked to any of the doctors that have worked on the 2 secret floors of COVID patients? And can they confirm what's actually going on in there?
Secret floors.
But let's see. I talked to one of the ICU nurse practitioners, and I mean, he was saying, it's. I mean, the people that are in the ICU with COVID are going to end up in the ICU without COVID. They have end-stage renal disease. They have cancer. Like, that's people that die, regardless.
So they got the comorbidities going on, just like what you had said with your 6 patients. None of them was a 25-year-old just coming in from a jog, and all of a sudden he had a little cough and he came in, and then 2 days later he died. You're talking, you got people.
Yeah, we might have had, and that's the thing. Like, there's these isolated incidences where you'll have someone healthy that gets really sick or dies. Which, I mean, you kind of see that with the flu too, especially in really young kids, on the peds floor. But kind of I mean, I can speak to the whole vaping thing. We can get into that. I had a 25-year-old healthy kid that was smoking a weed vape, which I guess is what was really doing the damage to these people. And he ended up having part of his lung removed. He ended up in the ICU. He was in the hospital for 2 months, sick.
Was that like one of those like Chinese ones, like the black market ones, or was that like a legit one? Because if it is, this segment not brought to you by Lake Country CBD.
Yeah, I mean, if you run into that kid again and he needs a new guy, I mean, we got Jackson right here. He could probably hook it up.
No. But do you see like a lot of cases like that? Like just these like teenagers, late 20s, coming in,
Popcorn lung.
lungs hurting. Yeah.
That was one, and then I also saw another one. This like 15-year-old that was basically like a runaway child, and she was, who knows what, but she, I think, related, had really bad pneumonia, necrotizing, had kind of these isolated infections. She ended up having part of her lung removed as well. So I mean, those are two patients that I personally like saw and care for every day. So I've cared for 0 COVID patients. So that something like that, and how the media works is, you have this, you gotta have, this fear
Mongering.
You gotta have something to, fear mongering, so on to the next thing, and it got some media attention, the whole vaping thing, and then now it's totally forgotten.
Right, but the specifically the vapors that you dealt with, would you say that they ripped some sick clouds?
Yeah. Yeah.
Okay, cool.
Did you say at least if you've
Worth
already
it.
got the popcorn lung, let me see you blow some circles and then shoot a dart through it, okay? You've already got the lung.
Come on, Doc, go ahead and remove part of that fucking thing. I got a big comp this Saturday. Yeah. Dude, okay, yeah. I do, going back to the COVID stuff though, so you're newer at the hospital that you're at. How about some of like the old school doctors? Like, what are they saying? Are they just buying this and just going along with it? I mean, does that raise any questions for you? I'm sure when you got into doing what you're doing, this wasn't obviously you subjecting yourself to our horrible, terribly small show. You need to get the word out. But like, what are these doctors that have been doing this for 40 years? What are they saying about it? Are they just like, yeah, it's just how it goes?
Yeah, I mean, so for the most part, everybody knows that it's bullshit. So but granted, when I was in the ER, kind of before our peak was supposed to happen, there was a whole lot of just super libs down there, just whipping Trump every day for all our problems. It's Trump's fault, and like they were scared, they bought into it. But like shit, I don't know.
Well, I had a quick. Go ahead. Sorry.
So I feel like there's this, the way medicine has changed so dramatically, over the last 15 years. A lot of the older doctors, they just, they're not going to put up a fight. They sold their practices. They're part of the matrix now. They click boxes. They are miserable. They go home. They come back, do the same thing. And
It's just a paycheck at this point. They're just trying to ride it out.
Yeah. And so, but I mean, there is a lot of hope with, I think, a lot of the residents now, a lot of the med students, especially like when I got into residency. For the first year, I was just like, "There's no way I can do this. I can't sit in front of this computer screen and click boxes and make sure I'm doing what the computer tells me, dealing with insurance, making sure things are going to get covered, and then it's just nonstop, just checkpoints."
It sounds a lot like banking to me.
Oh fuck! Here we go. Yeah.
Were you following Rivers at all during your free time on Google Maps?
Yeah. Were you in good with the IT guys? Was it okay to just check your Facebook?
So, safe to say that nobody's really practicing medicine too much anymore. It's, just doing basically what the computer or the government tells you.
So, it's kind of a mix at this point. but there's because we spend so much time doing this bullshit data collection oversight that you don't have time to go. And I'm not like having a patient's all their like records, their notes right in front of me, being able to search through it electronically is awesome. But with that comes the cost of government trying to get their fingers and get all the information they can. But there you have 10 minutes to spend with a patient, and then you have 5 minutes to document. There's not enough time to be a good doctor. Time is our most valuable thing, and we don't have time to go. So, for instance, I had this patient I saw in the ED. I cared for him in the hospital. He didn't have a family medicine doctor, so I said, "Come see me." This guy had really bad lung disease, 40-year-old, never smoked. He had recurrent blood clots in his legs and his lungs. And, he was in the hospital a couple times before that. Now he's on blood thinners. He goes home. And he saw me in the clinic. And the second time he saw me, I went through his chart, pretty profoundly, because it's not normal for a 40-year-old to get blood clots, to have lung disease. So he ended up having these immunolabs drawn a year ago that clearly stated this guy has rheumatoid arthritis, which in rheumatoid can affect all sorts of organs, but basically had destroyed his lungs in the interim from when these labs were drawn, and nobody followed up on them. It was like nobody saw them. And that happens quite frequently.
So would you say from like these doctors that have been phoning it in, that be a major contributor to like the opioid crisis that we're in now? It's just easier to write a prescription, not have to deal with anything.
Yeah, and we can dive deep into the opiates. That's a good one.
Let's do it, man.
All right. So, man, there's a great, I think, documentary on Netflix or something, The Pharmacist. Highly recommend.
Dustin, have you seen that?
I recommended it to you guys a long time ago, and you still haven't watched it?
I watched half episode.
Thank you, Evan.
Strong recommendation.
So, to your question about older docs pushing opiates, not so much anymore. But there are doctors, and I don't know how they do it, these methadone clinics, Suboxone clinics, where, you got people lining up before you get there, and it's just it's a scam. So you had the huge opiate epidemic. People started dying all over the place. Then, the government decided to be the good guy and police opiates. But then they got this great idea for, all these now heroin users. We gotta bring them back in and, try to control them, have power over them, I guess. So the one time ever, actually this happened twice, where we were pulled from the hospital from our, for a day, where normally we would be caring for patients. And we had to sit through this presentation on Suboxone. And I'm sure the residency got some sort of grant, kickback, $5,000 or whatever. They
get a kickback just on showing you a presentation for this shit? And is that essentially that's encouraging you to push this product, or?
Yeah, so that's how they got in the door. They told our residency, we'll give you $5,000, and I don't know this for sure, but there's no reason why this would go down unless there was some sort of financial benefit. So
Yeah, John, if you would have watched The Pharmacist, there was actually a pretty good pharmaceutical salesperson that goes pretty hard on how like it's just a money racket. Like they're greasing doctors, like paying them thousands of dollars just to get them to push their meds.
Dude, I feel like I was just having a conversation with someone about like pharmaceutical reps and just how they're all just like stellar looking people, just like cut up, trim, like
if we
and they got the worst. Let me tell you, they got the worst job.
Drug
I could never do.
If we got a Suboxone rep on the podcast, you think we could get a cut of that?
Cut of that cheese,
$5,000?
dude. I'll rock a fucking Suboxone hoodie. I don't give a shit. Yeah,
I write no scripts.
A couple plugs from the podcast. And
I can't take you seriously in those headphones.
oh man.
So we got Zach, like the biggest dude here, wearing my 1-year-old's like little kid headphones.
It's weird because like I didn't take Zach seriously until he put the headphones on. I was like, oh,
I can't wait for the picture for this pod advertisement. It's just gotta be Zach, big picture of Zach with the headphones on, and then just all of us around him.
just a case of Blue Moons in one hand, a couple of AKs in the other.
Yeah. Sorry to derail us, Dr. Ice.
Oh yeah.
Oh,
So anyways, so
Proceed.
you were getting fitted for your Suboxone race car jacket.
Yep. So we've already been through one of these, but we're all kind of excited that we don't have to work. But then we had to sit through I think it was 6-hour long presentation. So this guy comes in here, and I think he was a doctor, basically, super lib, indoctrinated, believing that this is the best thing ever, and we're gonna end this opioid, this heroin epidemic. So he starts off saying, making this argument that we overprescribed opiates. We did this to ourselves. There was so much of them out there. And then he's pushing this Suboxone, and I'll get into it, but he's wanting all of us to start prescribing Suboxone and just, flood the market. And I haven't met anybody that is legitimate about using their Suboxone. They get it for cheap. They use it to get them to the next, heroin hit.
Can you give us kind of Can you give us kind of a nickel layman's tour of what Suboxone is?
Yeah, so Suboxone, it's buprenorphine and
Sir, I said layman's.
I follow you.
You lost me at P.
It's a long-acting opiate, and then in it as well is the antidote to heroin. So it has both of them in there, with the thought that if you get all these heroin addicts taking this, that when they get their heroin, they're not going to OD.
So it's kind of it's a lot like if you're kind of trying to nurse a hangover and you have a Bloody Mary the next morning, you kind of ease yourself off of your hangover until you get hammered the next night. But this is just so that they don't just take that full shot and it all of a sudden shocks their system type of thing.
Yeah. So the push was not so much for that. The how we were sold on it was that we got these we didn't really address the heroin, but these people are addicted to opiates. This is a way that it can be controlled and it's not dangerous. And it's just so what are we doing? What's the point here? We keep these drug addicts alive forever. So
it's just a different brand of heroin. It sounds like just a different low dose kind of
Heroin light.
yeah.
They're still on it.
Yeah.
Like,
Yeah.
Heroin.
And,
light,
and
yeah.
you can't
Yeah.
you can't die from there's the withdrawal from opiates or heroin is not life threatening. You know, you
Yeah, we all
you
saw
have
Basketball
diarrhea all
Diaries. It
over
just
the
really
place.
sucks bad, you know.
Yeah, it makes you
you
wanna suck
sweat, but you're not gonna die. Like that's and so I'll kind of get into it here because this whole Suboxone thing is fucked up from the top down.
Bring
let's,
it.
Let's take a deep dive.
Yeah, let's go. We're ready,
Shit your
man.
pants, dive in, and swim.
So this drug was made in England. What they were pushing for us is this film, like a sublingual film you put on your tongue or whatever. And I didn't listen to like half this presentation because I was just over it. But so they're pushing this film because like it's harder to abuse, blah blah blah. And then during this presentation, I'm kind of diving into like what the hell's going on here. And so about a month before this presentation, the federal government sued this company. It's called Reckitt Benckiser Pharmaceuticals for $1.4 billion. And they sued them on the fact that they were false advertising, that this film is better than just like a tablet as far as the efficacy.
I think it's fair to
And so-
interject here just to say Dr. Bobby Ice, now that he's naming names, does not want to kill himself. He is not suicidal. He's a very happy person.
Nobody that would want to kill themselves would go on hikes. Okay, so he said he went on a hike. Nobody that would want to kill himself would go on hikes, and he's very skilled at hiking. So if he falls off a cliff, it's not on
Has
accident.
nothing
Okay.
to do with it. Okay, go on. Go on exposing Big Pharma.
Thank you for that. That is,
Yeah.
I love it. I love life. So the federal government sues this company and then pays our residency to come in here and sell the exact drug that they just sued this company for $1.4 billion to push this drug that they just said was not as good as, like a tablet. So they just got $1.4 billion to basically go out and have sales reps to try and get everybody hooked on Suboxone.
So they stole it basically.
They got $1.4 billion to push for it. So there's another company. It's called Teva out of Iran. They just got they got sued as well, and they're providing the government with $23 billion of Suboxone.
An Iranian company is supplying the United States with an opioid. That's what I just heard.
Yes.
And $23
What?
billion
Yes.
of it.
And the government sued them too.
Yes.
What?
And they're paying. So the lawsuit went down, and how they got out of paying 1.4 billion, they're only going to pay 250 million, but instead of paying a huge fine, they're like, oh well, we'll just give you 23 billion of Suboxone to get off the hook.
Holy fuck.
That sounds like the style of warfare that those Chinese generals wrote about, where if you're trying to fight against a nation that you couldn't physically win against, you fight them in different means, i.e. give them $23 billion worth of opioids to fuck with their nation.
Yeah.
Also, what you say is $23 billion worth. Like, what the fuck is it? If you make it, or if you like, am I following this right? Like, if you
Is it
make
market
it, like,
value?
who
Like-
says what it's worth? So
Is
like,
it
So-
23
so
billion Iranian?
the
So you got like six pills.
equalizer
yeah.
what a medicine is actually worth. Good RX. I'm gonna let me see if they got Suboxone on here. Cash.
This just sounds just like how like China is basically, doing a little warfare with us right now via not only like the CCP virus, which accidentally got released. I mean, whatever, but also through computer hacking and things like that, because they know they can't take us on head on, so they're just weakening us. Through propaganda, through fentanyl, setting fentanyl. That all comes from China. Like, it's just weakening the nation.
Control mechanisms, yeah.
Yeah. So Suboxone will run you about, with your GoodRx coupon, $2 per little sublingual tablet.
That's a lot of tablets.
Which will last you a day.
That's a lot of fucking.
So $23 billion worth of that.
But that's with the coupon. The
yeah.
retail price.
No,
is
I
about
read something about a rebate.
$10.
Yeah.
$10 a pill.
Holy fuck.
Can't get that heroin? Not without coops, baby.
What is it? A couple cents to make? Like,
Oh yeah, I'm sure.
So who gets that product? I know it's owed to the government, but basically, who gets it to distribute? Because there's got to be somebody else making money off it, right?
Yeah, and so we had a resident before me that ended up signing a contract in North Carolina, and I searched for probably an hour to find this in writing, but I couldn't find it. North Carolina had this program where they would give you $80,000 if you went through this training, and it's like 10 hours, and then you got to do some tests, and I don't know. It's pretty easy to do, but you got to want it. And if you sign one prescription, you get $80,000. $80,000 of taxpayer money for signing one of these prescriptions.
That's 80,000. What, you just have to sign the one and then it's 80K, or is it 80K per script?
Well, no, it's a one-time deal, and I think it was sold as if you have Suboxone in your practice, and it was basically just to try to really start people with these pill mills.
So you've already got your practice. You do a 10-hour thing.
A 10-hour MK Ultra blast.
Yeah. Oh, definitely. Yeah. There's definitely electrodes in your temple. And then all you have to do is write your first script, and it's 80K. So,
yeah,
needless to say, I'm gonna go ahead and assume that all these doctors are good guys, and they're gonna see people who don't need this prescription. They're definitely not gonna write them the prescription because they put their morals above the 80K,
maybe,
right?
I want to say 10 to 20% bought into the bullshit. But even your libs, a lot of them realize, and almost all the older doctors realize that this is just straight up wrong. Because we'll have pregnant ladies in the OB clinic, and we're filling their Suboxone, knowing that this newborn baby is going to have to stay in the hospital for a week to withdraw.
God.
And then, and don't even get me started on DSS. They're not going to do anything. They're terrible.
Could you tell us more about DSS?
DSS?
Yeah, I know all about it, but a couple of guys here look confused. But tell for everybody else that's listening, I know what's going on.
So DSS, Department of Protective Services for Children. I don't know what it actually stands for, but basically, if you think that something's going down, something's wrong, and you need legal work done, you file you can do it anonymous or with your name to DSS, and they'll look into it for you. But granted, so we also had there's a couple good people there, but it's just people that go and get their paycheck and don't care.
Satanic
They've heard it all.
pedophiles.
Yeah. So
actually, now that you mention, I learned about DSS on that Wild and Wonderful Whites documentary. You guys watch that? The West Virginia one. They're when she was cutting up those, smashing up those pills and doing them after she had a baby, and then they're in that Taco Bell drive-through line, and she's she sees somebody in the window. She's like, DSS took my baby. DSS took my baby. That's how I did know about DSS. It's from that. Continue.
There
sorry.
you go.
Sounds about right.
So I didn't meet these people or see them I just heard about this from a resident, a coworker of mine, but there was this couple who ended up being brother and sister who were having sex and had
Seen that movie.
their first child was, had multiple deformities, and then so DSS does nothing, and then got pregnant again. I think a couple family members had called the hospital or had made it very clear that they were brother and sister, or maybe half brother. But they had another child who, of course, now is in the hospital with, multiple problems, deformities, and DSS does nothing. Like what? Why are we depending on a government that clearly cannot get the job done to do something? If we were in a tribe and this was going on, this dude's balls would be chopped off.
Yeah.
I mean,
yeah. And what is going through your head when you're seeing this stuff? When you personally are seeing this shit, like, I mean, what is really going through your mind? Because obviously, what you've, taking this career path and everything, and going through the schooling, and then finally getting the job, and now being in the thick of it. I mean, are you just having like these jaw-dropping moments where you're like, what the fuck is going on here? And do you look to the elder doctors of, the dudes that have been like the veterans, is this just how it is? Like, what are we supposed to do here? Because I do have to imagine that at some point your hands are just tied, right? I mean, what do you do?
Yeah. So I think the older doctors, they just have checked out. They're not gonna. They know it's fucked up, but at the same time, they've seen it their whole lives. And I was thinking about this earlier. It seems that all of these government programs and all this crap in medicine, we're kind of the last stop. We kind of see it all, and then we're almost like expected to fix it all. So I think maybe that mindset, they feel like they're justified in not doing anything. Why is all this burden on me? It's not my problem.
Right. Maybe they feel like they put their time in already. I mean, would you say that a lot of your peers, though? I mean, I'm looking for a shred of hope here. Is there people that are, looking like is there an awareness like you have amongst all the newcomers, maybe like the younger people that are like, well, this is fucked up, and like, what can we do about it? Or is it just, is there just too much corruption and too much money to be made, really, that your hands are tied and there's nothing you can do about it? I mean, what's your stance on that?
So I spent the first year of residency with those exact thoughts, and this, and knowing that this is not, I can't do this, nor morally will I do this. What's the solution? And I was pleasantly surprised that I think there really is a solution. And this is not, and it comes down to just totally eliminating insurance, eliminating Medicare, Medicaid. There's family medicine doctors, internal medicine doctors that are basically doing a cash service where they don't accept insurance. So you pay, say, I don't know, a family pays about $60 a month. They have their doctor's phone number. They can call them whenever. The visits are free. and this doctor, it's called direct primary care. So this doctor has basically made cash deals with a radiologist that will read, all his X-rays, a lab that will be able to get blood work, like a basic blood panel for $3 when your insurance doctor is going to charge you about $40. And it's how it used to be and how it needs to be. There's often the analogy that with car insurance, you don't have insurance to get gas, to get tires, but that's what healthcare, primary care has become.
Right, that's the routine maintenance that you absolutely need and should be able to count on. But yeah, that's
and afford
Right.
afford. That's the thing, It's just and I think that's a start. Kind of a grass. I guess you would call it a grassroots. Primary care we're seen as like, the dumb docs that we get paid like the least. But if and I'm gonna be there's a lot of residents, there's a lot of med students that are buying into this, and it's legit, it's real.
Would you say that
it's
a big
happening.
reason for that though is what it takes to become a doctor, the schooling, the money, like the debt that you're taking on to do this? And if someone's telling you like, hey, if you write a prescription for this, we're going to give you $80,000, like you're probably thinking like, I don't give a fuck who I'm hurting. Like,
Yeah.
I need that money. Like, I mean, it's,
Yep.
so, and there also is a disconnect there too. 'Cause like, and correct me if I'm wrong, like, but the disconnect being when insurance is involved, you're not billing the patient directly, you're billing insurance. So like, you're
Right.
unless you're really looking
And
for it, you're not seeing like your itemized list of the
it's-
shit they're billing you for.
Yeah, it's ridiculous because we have no idea what the cost of things are. We have no idea. We're not trained at all what the cost of something is. We it's never brought up. Maybe we should talk to the patient and see if they want to get this CT scan, that they're going to get a bill for $2,000, when the likelihood of something, it actually showing something is 1%.
Dude, I literally had that happen to me once, where I was given a CT scan without my knowledge of it, because I was all cold at
Yeah.
the time. And then that just so happened to be like the year where something was fucked up with my insurance, so I didn't have insurance, and it cost me $3,000 out of pocket.
Surprise!
Yep.
And I did not consent to a CT scan.
Yeah.
Is that even disputable, or are you just on the hook? for it?
No. And let me tell you, it's kind of scary because ER doctors, they get paid. There's a thing called RVUs, which is basically everything you do is assigned a number, and you get paid based on that. So if you do more, you get paid more. If you admit a patient, you get paid more. If you bill what's called critical care time, where if someone's really sick, then you and it's ridiculous. When an ER doctor sees you, their mission is to figure out how they're going to get you admitted to the hospital, even though you don't need to be there.
Holy
And
shit.
then
I'm getting triggered right now, dude.
and
I'm getting
that's
so
the way
triggered.
that's the way they make their money. It's not their fault; it's the system's fault.
Can I ask you something kind of along these lines, but switching up a little bit, as far as
Yeah.
with what you said about the Suboxone stuff and the $80,000, and I know there's the couple times I go to the doctor, it's almost like there's a flavor of the month with pharmacy reps. Like, oh, you could try this. This is new. Is there paychecks or like bonuses associated with pharmacy reps coming in trying to push new stuff? And also, the thing I'm curious about is vaccines. For vaccines that kind of everybody, they're kind of pushed as just, you just need to do it, don't ask questions, this and that. Is there any kind of like separate payday associated with all these new vaccines that are coming out that are probably not necessary?
So as far as the drug reps go, from my experience, the only, it's just kind of part of the job. They'll bring you lunch. You sit there and listen to them for maybe, it depends. A lot of doctors won't even like go and see them. They'll just basically feed the staff. You talk to them for like 10 minutes and then.
AKA Heather Locklear in Scrubs. You see that episode? It's great.
Oh, I don't watch Scrubs, but yeah.
God damn it.
This used to be an issue. I guess an issue where they would, fly you out to Hawaii, but a lot of doctors, they're not going to prescribe a medicine just because some hot girl talked to them about it. At least I hope so.
So there's not, is there kind of with these new medications or something, the hot new medication in the streets, there's not really a bonus? Do doctors get bonuses for pushing something, or not really?
So a little bit. There's these quality metrics where it's not necessarily a specific medicine, but say you have like a heart attack, then we'll get, we get the money we should get if we prescribe you a couple medicines that go along with heart attacks, like a beta blocker, an ACE inhibitor, a statin. Those are routine. You have to prescribe these, or you'll be docked for it. So I guess there's that, but that's more so. I don't think that would be the pharmaceutical company meddling.
But do you get like like a hospital manager? They won't come up to you and be like, "Hey, this is we just bought 500 units of this. We'd like you to push this more than the other thing."
Yeah. So in the hospital, there's our formulary where it's the medications that we have in the hospital. And I'm not sure, you'd have to talk to a pharmacist to get in the weeds with that as far as how, why some medicines that we have that aren't as good as other ones. I think a lot of it just comes down to how good of a deal the hospital can get as far as price goes.
So there's really no direct.
Yeah, I don't have a whole lot.
Direct connection between
pharmaceuticals.
Yeah, pharmaceutical reps and doctors. They're not just like shoving a fucking wad of
that
cash
we know
in
of.
your
It could
pocket.
go up to it just could go up higher. Whoever's in charge of buying said, whoever's
Right.
in charge of buying it. You never know.
Right. You never know. We don't know what this guy's what this guy's hiding from us. Come on. Yeah.
One of the reasons you heard the stories about the Purdue and the doctors in Florida that were writing 80 prescriptions a day for OxyContin, and
Right.
I didn't know if that applied to other pharmaceuticals.
Is that more of a family practice? A family practice issue than a more of a family practice issue than a general hospital issue, or like with the because then they basically
pushing opiates and
Right.
all this.
right.
Fuck it.
If what?
Oh, nothing. We thought you just.
I thought
said,
you just
"God
like
damn,
got
these
blown
guys-"
over by a
just
tornado.
got iced, man.
Oh. I think it
Got way
comes
too
down
close to the truth on that one.
there's good people in the world. There's mediocre people in the world, and
there's Bobby
evil
Ice.
people in the
Oh,
world.
I'm sorry.
Would be my answer to that. Whether you're a doctor or not, if you don't care, if it's all about money, then you'll do that however you can.
Yeah, there's shitbags in every industry, really.
Yeah.
And
Yeah.
I guess that's really sad. And I'm sure when you got into this whole field, you would assume that everybody's going in with the best of intentions, right? I mean, of course, we all know.
Yeah.
And I guess you had kind of mentioned that in your text message to us before we got started. Just the problems with just the whole medical industry as a whole, or like what?
Yeah. I mean, I could just go on forever. It's nonstop.
Give it to us.
I want to, I guess, go back to Zach's second question about the vaccines real quick, because I'm kind of interested in that as well.
Yeah.
For the longest time, I just thought, you just go along with it, get vaccines, like that's what you do. But now with the whole Bill Gates vaccine deal for COVID coming out, I'm a little freaked about it. And I just kind of want to know your thoughts.
I don't think you need a COVID vaccine. So what we learned in med school about vaccines is, of course, the link to autism. We actually read the study, and I don't remember his name. I think he was out of England. That basically produced this pretty terrible study, to be honest. Linking autism to vaccines, and then it just took off. Of course, it gives these people suffering that their kid has autism a reason and someone to blame. But as far as vaccines go, the issue is that there's kids that can't get vaccines because of medical immunologic reasons. Their immune system couldn't tolerate it. And if we had a mass amount of people not getting vaccines, then you have, these are real diseases, measles outbreaks, people die. I like to say that no medicine, no vaccine, no medicine is a good medicine. No vaccine is a good vaccine, but measles is not good either. Measles is worse than a vaccine. So if everybody didn't get vaccinated, then you'd have people dying all over the place.
But you had said that, like, some kids don't get it because of their immunodeficiency, but what about, like, there's so many things in there that we don't know if somebody's allergic to it or not until we give it to them. Like the analogy that, like, I could give 1 million kids peanut butter, I'm gonna kill some kids. I know that for a fact. Like, what about that argument?
And that's the same as COVID. Let's open up everything, knowing that a couple people are going to die, but at least our freedoms and people can go on living their life.
Sure, yeah, I understand that, but then there's also that the vaccine that vaccine payout, where they've paid over, what is it, $15 billion to vaccine kids that have been hurt by vaccines. $4 billion, yeah, $4 billion. Like, I mean, like, that's real, you know. That, but what the problem is with that is that, like, that's taxpayer money.
There's been some messed up stuff in the past with vaccines, and we had a lecture a long time ago, and there's been some big screw ups. So I think the public has every reason to be weary of it. But, coming from somebody that questions the motives behind what we do as doctors, I think vaccines is one of those where it really is necessary. Would be, because, of course, if you decide for your child not to get vaccinated, it'll probably be fine. But if you have a large amount of people deciding, making that decision, then you're gonna have outbreaks, and your child could die. That's the real truth behind it. There's a concept called herd immunity, where if you have 90% of people vaccinated, then it's an exponential logarithmic that there's not going to be an outbreak. But if that number comes down into the 70, 60, then you're gonna have people dying all over.
I think that's kind of where, because my wife and I argue about this quite a bit, and as far as vaccines, she's like, well, the a lot of the medical studies and stuff that's taught in school is in fact funded by the manufacturers of the vaccines. And my whole thing is, as far as the whole supposed anti-vax movement, and really I have no problem with people questioning what's going into their body, what's going into their kid's body. Like you said, everybody's going to have different reactions to different medications, and there's some doctors that are great, and there's some doctors that could care less, and they'll just do whatever they need to. But I think that's the point I was trying to get at, is I don't think it's so bad to question what's going into your kid's body, what's going into your body, but yet there's this narrative where you just don't ask questions. Just, you just need to take it, because if you don't, you're an evil person, and you want to get people sick. And I think it's a little more nuanced than that, as far as why shouldn't people be questioning everything, especially what's going on with their kids.
Well, so that was actually told to you.
Yeah,
right?
that was kind of because I'm not an anti-vax guy. Don't get me wrong. Like everything you said about herd immunity and all that stuff.
I can't hear you.
You can't hear me? Can you hear me now?
Uh-oh.
Ice.
Oh, I can hear you now.
Okay, cool.
Ice.
Right. So what I was saying is,
Iceman.
I'm not anti-vax or anything, and I I totally understand the herd immunity. I get that. But that was the thing, is I have a 2.5, almost 3-year-old son, and when we went in for some vaccines, when I was when I had first started researching a lot of this, and just trying to be aware of what's going on, and not saying that anything is bad. I was just trying to be informed, and I only raised the question of what was in the vaccines when we were at the pediatrician, and my son was about to get shot up. And the first response was, well, if you're not going to vaccinate him, I can't be your pediatrician anymore. Like I got immediate pushback just because I inquired about what was in them. So I felt like the doc was immediately on guard, and I wasn't confrontational. I wasn't anything, because I'm a very layman, and I was very new at this, and I'm talking to a doctor, so I wasn't going to come off as though I am smarter or more than the doctor.
Right.
I came off
just like, hey,
I came
what would you say is in
I was like, if I were to, if this was a cocktail, what would I be mixing here? It was very like hat in hand. Like, so what are you gonna put in, my son here?
You got that big old needle over there.
Yeah, and she just she just put her dick on the table and told me to shut up.
Was your doctor's name
Michael
Michelle
Obama? But no, on a serious note, asking the question seems to get like harsh feedback.
Ever since you told me that story, I've kind of told that to people just in conversation. So do you have an explanation for why she would be so defensive about that?
I think it's a couple things. One, she probably doesn't actually know, to be honest. I couldn't tell you what's all in the vaccine. It's not something that we learn, or I guess we're led to look into. We were, and then another thing is time. She doesn't have time to sit there because of the system to sit there, and if she was a good doctor, she would do it anyway.
And I get it. And I get it how somebody's like, she's been a doctor, she's been doing this for years, she went to school for God knows how many years, and then she's got some asshat who read something for an hour online asking her questions. Like, I get where that frustration would come in if she's got a lot of people, asking that. But I feel like I would deserve and I'm sure this doesn't happen to everybody. And she's a nice, and like, that was what like took, because I like her as a pediatrician. I wanted to keep her as a pediatrician. But like, and I get it. Like, she doesn't want these fly-by-night vaccine experts. But
Right.
I just wonder why, like you said, like, they don't have the time. But do you see stuff like that where you're in the break room and a pediatrician comes in and is like, it's another fucking ass clown asked me about these vaccinations again?
It's possible that she
So
was late for a
the-
Suboxone presentation that might have had a $80,000 incentive attached to it. I mean, is that possible? It's possible.
Anything's possible, but so the clinic we work at, we don't accept anybody that doesn't vaccinate. So I don't have a whole lot of experience, but granted, so in the newborn nursery on the OB rotation with new babies, we'll sometimes get somebody that it does not want, and honestly, it's usually the Russians. To be honest, we have a huge Russian population, and they decline the hepatitis B vaccine for their newborns, and then of course you can only do that by signing a little form that says this is because of religious reasons.
Can you
Which is
can you give some insight as to why kids that are so young need a Hep B vaccine, and also kids that are real young, why do they need, or why are they pushed to get the HPV vaccine, which is shown to cause quite a few issues? But like, my 5-year-old son's not eating box, so I don't understand why he would
5
need.
years old. They're trying to give the HPV.
Well,
Sorry, Junior, you just got
he
called
just
out.
turned 6. He just turned 6.
Oh my god, I got this.
I don't have a good reason.
I'm sorry, Dr. Bobby. I just gotta tell you, Zach, I'm a little disappointed. He's
What?
6 fucking years old. He's not eating box.
Well, he just turned 6, so I mean, he's getting close. But
Okay.
Okay, continue. I'm sorry.
As far as the hepatitis B, I'd have to be honest. I don't know why it's pushed so hard at birth.
so maybe the Russians are onto something.
Yeah, maybe.
So
For sure.
if
they
so
left,
you don't-
they left Russia, so they got that right.
but Dr. Ice, you don't that's not a vaccine that you administer.
Hep B.
No, I mean it's.
So why would that be
it's just-
different too? Is it
You
just
just
state
click
by
the
state?
button.
What
You
is
click
this
the
thing?
button. Actually, the nurses order everything, and then you just click the yes button. That's
Well,
that's all the thought that's involved.
with my son,
Yeah.
his
Explains
pediatrician,
a lot.
they were one of his appointments. They wanted him to get the Hep B vaccine, or it came up, and the pediatrician that we had at the time, basically, was it the Hep B? No. It was the HPV. It was one of the two. I forget which.
Wait,
one.
and how old? If it would, that would be usually around, I think 12 is when we start talking about HPV
So
vaccine.
it was probably the Hep B vaccine then, because when we came in at the
Yeah.
time, he said, the pediatrician at the time said he doesn't. I think it was the Hep B. He basically said my son doesn't need that at the time when he came in. But I think those two vaccines are just kind of, a lot of people question those two in particular. As far as the HPV, I know it's when they get older, but still, it seems
And
like the
that's
HPV.
more like as a male getting you're as a male getting that, you're getting it for females. HPV is associated with cervical cancer. That's the biggest. That's why it's given. But if people weren't sleeping around with everybody, it wouldn't be an issue.
Right.
That's a tall order, sir.
But what about the Hep B? Why is that given so at such a young age?
I think maybe, I don't know. This is just me thinking off the cuff, but I mean, with any vaccine, the earlier you get it, that's more protection. But as far as like, newborns, toddlers, they're not more at risk for hepatitis B. But I think, if so, as a physician, if you had this child in your practice that didn't get a hepatitis B vaccine, and that was their parents' decision, and then, got it and died, worst case scenario, you would feel responsible, even though really it was kind of the parents' decision. So I think there's some of that. Like, you don't want to be, that doctor.
Yeah, and let's I just want to say one thing. Like, don't get it twisted. We're not trying to put you on Front Street here. We just don't get to talk to a chill ass doctor like you very much. So we're not trying to put you on Front Street here. There's just a lot of questions that we sit, like you said, like we get that 10 minutes with our pediatrician. That there's so many questions we want to ask and we can't ask. So we do appreciate you fielding these questions, and we're not trying to put you on blast here. We're just like, we appreciate you fielding these questions because we just don't get to ask them.
No, but you could send the bill directly to Dustin_lamp@yahoo.com.
Yeah, everybody already know. If you go back a couple episodes, you'll know my password, so you can just go ahead and log in on that. So, yeah, no problems there.
Bank account, same password.
Yeah, it's good to go. So, yeah, so we do appreciate you just answer these questions, and like I said, we're not trying to grill you here. It's just like, this is good stuff that we don't normally get to ask, and if even if there's something that you don't know, we just appreciate you just kind of give us a little bit of insight on what's going on, because these are questions that we don't get to ask all the time. We don't get to ask people, so we do really appreciate you answering these questions. I just want to make sure that that we're not trying to grill you here. We appreciate it.
Bobby Ice is for the people.
Yeah, fuck yeah, we love Bobby Ice. Hey, Shiva for president, Bobby Ice for vice pres.
Shiva Ice 2024.
Dude, speaking of Shiva, what do you think about? Have you been following Shiva stuff? What do you think about this guy coming out, just leading everything? Basically starts everything with I'm Dr. Shiva and I'm against the deep state. Does that just give you kind of a little peoing, a little bit of a chub action going on there?
There is no such thing as a little chub when it comes to Dr. Bobby. We're talking big chubs. Continue.
So Shiva, fill me in on who Shiva is.
Dr. Shiva Ayudare. Out of Massachusetts.
Yep, he's running for Senate against Elizabeth Warren.
Inventor of email.
He holds 5 doctorates from MIT.
Yep.
5 or 3?
Dang, I'm
three.
unfamiliar
5
with
doctorates.
Dude, we'll give him 5. If he doesn't have 5, he needs to have 5.
We gotta let Dr. Ice familiarize himself with Shiva, and we'll bring him back.
Yeah,
let me. Yep. While you're familiarizing, I'll.
Oh yeah, by the way, you only get about 3 minutes to familiarize yourself.
VA_Shiva on Instagram.
He's probably live on Instagram right now.
No,
he's
dude, I just
live.
got Keith just hit me up, dude.
Oh,
so Keith is connected with a nurse. Check this out, Dr. Ice. So our buddy knows a nurse. She works for a big hospital chain out here. Wisconsin has 101 COVID patients inpatient currently. 101
for the whole state.
For the whole state, and Evers wanted to extend the shutdown for that.
Our governor sucks, by the way. Just so you know.
Oh yeah. Hey, but y'all's Supreme Court said it's unconstitutional. So can't you do whatever you want?
I was
as
at
of
I was
2
at
days
the
ago.
I was at the cigar bar last night, baby.
So right, this so this was 2 days ago, right? Wednesday at 5:00. Everything was just kind of opened up with no restrictions. And Jackson, you worked for a restaurant. He was actually working because they were still doing the carry out.
Miss of it. Yep.
Yeah, while they got the news.
Yep.
So, but places opened up immediately, and I guess a lot of bars were packed. I just had
Nice.
I'm always like thinking about just everything that's going on right now, and just I had to like throw this out there to you guys because it's still just like it boggles my mind how backwards all this shit is. Like, what's just funny right now is that you have referred to them as the libs, but you got like the left, like the hipster, like punk rocker, like those are all the people that are telling you to like trust the government and stay inside, where you would think it would be the exact opposite. Like you would think that right now it should be young people in the streets saying like fuck you, fuck authority, like we're gonna do what we want.
Antifa.
Well, no, I mean like protesting businesses being shut down and like going for the people, but instead it's all of these like hipster art school nerds, like
It's like punk rock to stay home now.
yeah. But that's what I'm saying. Is like I'm
Yeah.
I'm trying to process this in my mind. It's like there should be like fucking house shows and people going crazy, and the neighbors should be like, "You fucking kids, get out of here, go home. You're gonna kill everybody."
Yeah, and
but it's them that are doing it, and instead, right now, what's punk rock is to be like a gun-toting like country singer, conservative, like
Zach Enzi to be Zach Enzi.
I can't. Well, but I mean, you look at who's showing up to some of these protests, which I don't really get that either. I'm not aligning myself with a lot of the protesters because you got dipshits showing up to that too. But it's like, it's just how it's completely flipped. Like you would think that it would be the younger people that are trying to open shit back up, but instead they're talking shit on like the old people that I don't know.
Well, it's easier like you've said before. It's easier to virtue signal, sit at home and say, "Hey, stay at home," because you're putting people's lives at risk, instead of taking what is now the hard stance, which is, you know what? No, I'm not going to put my life on hold. I'm not going to put my family's life on hold. I'm not going to let my children inherit debt that we've created because of this. So it's easier to stay at home, because I don't know if you've noticed this, but a lot of the people that when this first happened, there was a lot of people who were like, "Oh, this is terrible. Why are we doing this? Why are we doing this?" They switched their stances pretty quick. And now the same people who were fighting the power on Facebook are now saying, like small business owners that I've seen that fought it at first, as soon as they were given the okay to open up, they're like, "Well, no, we're not going to open up. We're still going to wait. I got some PPE on order. We gotta figure this out."
They're probably scared of like pissing people off. Yeah. It's so fucking.
So what?
bizarre.
Yeah, what? It's like people have flip flopped, and people that just want to live normal lives are being being made to feel bad. Like people are saying that they're killing people just because they want to live a normal life.
Well, yeah, and Iceman, you can attest to this, because what they keep saying is, we're gonna choose to trust science and real doctors, and they make you think that if you get your information from anybody who's not shoved down your goddamn throat on mainstream television, that's not a real doctor. That's not real science. Like, I don't think there's a clear-cut answer one way or another. This is a straight-up debate, right? And
right,
what you're saying is the numbers don't reflect that.
Yeah,
everything should be shut down.
It's not really in a debate anymore.
I think.
Yeah, I mean, it might have started off as a debate when all we had was the China data, but I think clearly now you can say that this is 100% fake news.
Going back to what you said, John, I think a lot of the progressives.
Oh, I I can't hear you.
Oh. This is important.
What's going on? Bobby!
Can you
All right,
hear
I'm
me,
back.
Bobby?
I'm back.
I think with the progressives, they've been kind of anti-constitution to begin with. So this kind of falls in line with anti-constitutional. They've been wanting to change the Constitution for a while. So I think that's why they've been quiet, is because this kind of falls in line with what they've been advocating for the whole time. They don't want...
Yeah, they don't want a constitution founded on the belief that we are not gods. There is a God.
Right.
I mean,
They want
that's my thought on it.
they want the powers that be whether it's the mayors or the governors or the Senate, House. They want them to have the power to be able to tell you, this is what you can do, this is what you can't do.
Yeah, I was listening
Right.
actually on Jimmy Dore, that Dylan Radigan, who is the shit. Yeah, but that, right? That's exactly what you're saying. What it seems that as if what they want, which this would be great, but this person they're looking for doesn't exist. They want one person, one like wholesome, just perfect person to like take the reins and do what's best for everybody. Well, that's an impossible thing. Like there's too many people in this fucking country for sure. 356 million or whatever it is. Like that's a lot of people. Like we're all we're all under one flag of America, but where you are, where we are, where big city, small city, like there isn't one truth for everybody. Everybody's in a different situation. Everybody grows up from a different perspective. You have people growing up on the south side of Chicago and people growing up in bumfuck nowhere, New Mexico, and they're both Americans. Like you're going to find one person that knows what to do for everybody, the perfect thing. And that's the other thing that just drives me crazy, is how so much blame is put on not just like the current president or any president. If you think that they just hand the keys to the kingdom to some fucking stranger every 4 years off the street, like how deep, medically speaking, do you have to have your head buried in your ass?
That's medical.
Doctor?
Well, to piggyback on your point about how progressives, they don't give a shit about the people. I mean, we're on CARES Act version 4.5, and we're just now starting to talk about actually possibly helping people. All you have to do is recognize that the first reaction when all this happened was to bail out hedge fund managers and to shut down small businesses while they allow big corporations to stay in business. Why is it dangerous for me to go to a mom and pop shop to get what I need, but it's okay for me to go to Walmart with 300 other people? Like that right there should tell you all you need to know about the government and who they actually give a shit about.
Yeah. And I almost want to say that you're giving the government too much respect as far as to be able to pull that off. I'm very convinced that there is evil, Satan at play behind where culture, America, where things are headed. And now with COVID, churches are non-essential, even though in the Constitution it's our right to freedom of religion to gather and assemble. And they're still not opening up, even though you have restaurants and stuff. I think a lot of people are kind of waking up to that there's something not quite right here.
New World Order.
Yeah.
Well, I think that's something important. An important distinction between this country and other countries around the world is a lot of other countries are under the impression that government gives them their rights, where in the United States, I wish it was more widespread that people would understand that government does not give us our rights here, so they cannot take them away. And it's
Right.
kind of a defining part of this country is government does not give us our rights. So it's not up to them. It's not up to anybody else whether or not we can go to church, we can go to the fish fry, we can go to a small mom and pop store and carry on with our lives. But, you know, with what you see going on in Canada and a lot of other countries, is just, it's absolutely ridiculous. And it surprises me how many sheep are in these other countries that they just, oh, okay, so sorry.
Yeah.
Well, some people just want to be taken care of, I think. You know, it's easier to just have somebody tell them what they can and can't do than think for themselves. And
Yeah.
I mean, it's rampant.
You would think there would be more
And-
rebellion, right when it hit, but everyone just is following what they see.
Yeah, not to. I'm sorry,
Yeah.
we keep cutting you off.
Yeah.
But just like the way this all kicked off, it was. I mean, it happened really fast, but at the same time, it was slow enough that. And being a small business owner, you play ball. Like, oh, okay, everybody's shutting down. Like, you saw it happening. You know, oh, these people are shutting down. This is shutting down. Oh, now I have to shut down. Okay, like you play ball because it's going to be 2 weeks. Like, okay, I guess there's a fucking crisis. 2 weeks, big deal. Like, and then it's a month, and then it's extended a little bit more, and then it's 2 months.
It's the frog in the burning
And now,
pot.
right, and now
Boiling
they've
pot.
successfully politicized this to the point that you're a selfish, racist piece of shit if you want your small business to open back up. I mean, that is honestly where we are at right now here, which is pretty insane. And at the same time, LA County is extending another 3 months. I mean, I don't know what it's like where you're at exactly, but that's just what I mean. It's because I'm in that same position. What you were just saying before about how now it's time to, like, you get the A-OK to reopen, and I myself am like, and which is totally fucked because anybody who listens to this knows my whole fucking shtick here, but you know, you do start to second guess, like, okay, like, should I, is the shit that I'm possibly going to get for opening up worth opening up? Do I wait and virtue signal a little bit just to, like, play the game? Like, I'm going to wait a couple weeks too, but it's tough. Like, there's no good answer for it. I mean, this is just so fucked. I mean, everything that you've, and I really do appreciate you taking the time and hanging out with us and getting a doctor's insight, someone who's in the thick of it. And like I said, so I don't know if you knew this, like, I work for UPS, so, like, we've still been working this entire time, and that's the whole thing. It's like,
John, he listens to the pod. He
all
knows you work
these
for UPS.
fucking- all these fucking essential employees, like being called heroes. It's like, you don't. A lot of them don't have a fucking choice. Like, all the people that are still working drive-throughs and shit, like, are they being heroic, or are they just lucky enough to still be able to work to pay their fucking bills? You know, I mean, that's what's just kind of ridiculous about this.
I got a piece of inside information on a local grocery store near us that is from a manager of the grocery store. They have had 0 positive COVID tests at a grocery store. So wrap your head around that. Like, you think all these people being exposed to everything, and they test them regularly.
Now, my thing,
0.
why the fuck wouldn't they put up a banner poster outside? You know how McDonald's has 99 billion served? Why wouldn't they have a poster that says 0 positive COVID tests as like a marketing strategy?
That's the
like,
wrong
come on
narrative.
in.
Wrong narrative to be pushing. They would be shut down immediately.
Yeah. Well, of course they would, but I'm saying from a consumer standpoint, I would probably go to that grocery store.
And then they would come up with a mysterious listeria outbreak at that location, and they'd be shut down.
Yep.
That's very likely. Bobby, I don't know how your bladder's doing, but we all have to piss apparently.
Yep. I'm there. I might take a little 1 minute break here.
Take a breather.
We'll keep
Go
going,
for it.
dude. We talk.
Yeah, go for it. 'Cause I'm
You
gonna
keep
go.
going.
I'm interested if we have time later to go full Satan and just go down that path of what's going on.
Let's go down the dark path.
The dark path. I mean,
Dude, as he's wearing that t-shirt.
Bobby Ice. So,
What is he doing?
What is this? Mike Vrabel's draft room?
Dude, Bobby.
oh my gosh.
The doctor is in.
You did that on purpose?
No, he doesn't know what he's doing.
So, anyways.
No, this. My wife and I were talking about this today. You see the billboards for the heroes work here.
What is he doing?
Oh, I'm so distracted. Zach's got a really good point to bring up, and I'm just super. Dude, he's still going.
This is the longest piss I've ever.
Dude, we should have timed it when he started at 1:39 and 30 seconds. What is he doing?
He's cleaning the floor. Cleaning his legs. I guess for the listeners, we got Bobby Ice on camera. I think he was taking a piss in the background, and
Did he close the door?
now he's gone. No, he didn't close the door. Me and Bobby go way back, and we have an open door policy, and he still honors that. But
So anyway, Zach,
anyway,
if you can compose your thoughts here, what were you gonna say?
No, back to the pre-piss point.
where'd he go?
The whole. I don't know about you guys, but every time when you drive around, you see the billboards with we got heroes that work here and this and that, and it's like, I'm not trying to talk down on the healthcare workers, but as far as my line of work, getting into storm season, where it's storms roll in, knock down poles, knock down power lines, and we just go out and fix it. And that's the dangerous time. That's when
Did you pack any?
dudes get killed. That's when dudes get hurt, and it's like it's just expected of us. We just go out and do it, and we don't need billboards. We don't pat ourselves on the back. We don't need people to come up and tell us how great of a job we're doing. It's just you just do it year after year. So a lot of these billboards and stuff, and I just don't get it.
So basically, yeah. So what you're saying is basically like you guys are on the front lines all the time. I mean, you guys have guys get seriously hurt or even die in the line of duty.
Yeah, but
it's become normal for people.
Well, it's part of the job.
Right.
It always has been. It will be, and it's like that's what I signed up for. That's what I'm going to keep doing, and it's like all of a sudden there's this I don't know. It just seems kind of like self-congratulatory.
Yeah, because
it's
if you
self-congratulatory,
well, right,
because like he said, they had the hospital put on the fucking parade.
Right.
Like, they called themselves heroes.
Because if you said, listen, I'm not going to put my life on the line just to give you power to your Wi-Fi, go fuck yourself, then it'll start affecting people's lives, and then you might be heroes.
Well, not only that, but I would expect people to say, well, what the fuck? This is what you signed up to do. Do your fucking job, right? More or less.
Yeah.
Um,
And then you got the whole Facebook push,
right.
Stay at home so I can be at the hospital. It's just
Yeah, I was gonna post a meme that said we should start thanking chiropractors because of the good job that they're doing from helping out all the nurses from patting themselves on the back, but all the
Or their TikTok dances.
I got a lot of nurses in my family, so I didn't post that meme.
Oh, okay. Well, you pretty much just did. Yeah. Yeah.
Man, that'd be a good one.
Dude, well, maybe this is a good time for my Reese's story. So, Dr. Bobby, I had UPS, who was named by the president as one of the companies that was going to get us through this pandemic, continuing to deliver business as usual, no PPE, no hazard pay. What we did finally get on Thursday was a very nice man walking around with a bag of fun-size Reese's peanut butter cups. And he handed me one with a little slip of paper that said, "We appreciate everything you do."
Oh, thanks.
And I still ate the candy bar, so that would make me the piece of shit. I understand that. I basically said thank you so much. I appreciate this gesture by eating it. Instantly I regretted it. Now, am I a piece of shit?
You can't turn down something for free.
All right. Yeah, you have it. That's true. Yeah. So that's what
Do you get the what? Do you, and I think this is just another sign of just people being told when to like monkeys to clap their hands. But what do you think about that whole like in the bigger cities, people banging pots and pans and cheering at shift changes and stuff like that? Like, is that just a whole giant manipulation? Yeah, just they're just like. Now they're just playing with us at this point. They're like I said, it's like a trained monkey. They're telling us when to clap our hands now.
Yeah, I mean,
were you a part of one of those pots and pans lines, or did you see that happen?
No pots and pans lines. I don't know. And part of the issue I think is that a lot of doctors, nurses, they have this idea in their head that once they're a doctor, things are going to be different. That they're going to be, they're going to get the hot wife and everyone's going to love them and they're going to be so smart. And I mean, honestly, like, we shouldn't be held on this pedestal. I mean, to be honest, we went to school forever. A lot of it was just, getting the grade, checking the boxes. A lot of it was just a waste of time. Jumping through hoops, but so you get there, you're finally a doctor and it's empty. It's especially in the system that's in place now. So I think to have some sort of recognition that it's infectious. Like they finally, I'm appreciated for how great I am, I think is the mindset.
Yeah.
UPS is hiring, just in case you were considering a.
And also, trigger warning.
Change.
Trigger warning. I do think that nurses are the most self-appreciating class of people in the world.
I think teachers actually are.
Trigger.
Whoa! Jeez, shots fired.
I have to say they're 1A, 1B. 1A, 1B. Yeah, I agree.
I mean, to have every summer off, I mean, that's rough.
No, we're leaving it in. No.
It's
from the heart.
I had a doctor. I got a call for a power outage at work, and I show up, and it's this mansion. And this is kind of when everything was kicking off with the whole COVID thing. And this doctor pulls in with his Tesla, and he's just like, I'm just so scared. And he's wearing a stethoscope around his neck like a Jesus piece. And he's telling me how scared he is, and like he thinks he's going to die and this and that. And it's like, well, why are you have a piece of medical equipment that you're wearing back and forth, and he's more concerned about his Tesla running out of power, then that's why he left, right? So he's telling me he's got all this stuff going on, but his power's out, so he's got to come home and make sure he can charge his Tesla. But that's
you don't have quick charging stations?
not at his house, apparently. But
at the business, he wasn't trying to come get a quick charge and
I guess
pull a
not.
quick one on you.
I guess not. He must have been at a low rent hospital.
Well, you are near the Illinois border. You are near the Illinois border, so it is probably low rent.
In Illinois, yeah.
Yeah, right.
Dr. Bobby, I believe, is from Illinois.
Dr. Bobby, is your stethoscope a Jesus piece?
No, I don't know. I wear mine around my neck just because it's easy.
But
And-
like when you go out grocery shopping and stuff?
Yeah,
or-
but while you're flossing in your
No.
Tesla?
No.
But I guess the point I was trying to make is I think he was trying to wear it around his neck so that everybody would recognize, oh, this is a doctor. Which
Yeah, and I have no tolerance for that at all. and like for Costco to be like, oh, we're gonna give you an hour before we open for the healthcare, like I'm never gonna step foot in there to have special shopping privileges. Like what kind of sense does that make?
That's pretty bizarre, unless would their reasoning for that be that you're all that's basically the scarlet letter if you are in the healthcare industry, that your infected ass has an hour before everybody else to get your shopping done. Yeah.
I think it's actually because they're so busy treating these millions of infected patients. They need special hours to get in there, get in and out.
I think it was more of like a benefit. Like, you guys are so special. We're gonna open early, and you have the whole store to yourself.
Just think how many people were closing in on the end of their shift and just threw some poor fuck on a ventilator because they fuck it.
Gotta
got an hour to shop at Costco. Yeah.
I gotta live like a boss though and head to toe Costco.
Throw them on the ventilator. Send me my $39,000 PayPal. I'm gonna use this shit right now.
You know I gotta get a pair of them buffaloes, son.
Yeah. That's basically what happened. Verified. While you were, Dr. Bobby, while we were watching you piss earlier, Evan was thinking that maybe a good game plan would be go full Satan and talk about the war against pure evil that's going on right now, possibly behind the scenes. And
Yeah,
I'm into it.
But can we first just address the elephant in the room? Did you know that we could see you pissing?
Yeah, it kind of hit me that it might be a possibility when I was in there.
Right.
Was that before or
then
after
again-
you cleaned the floor?
Floor and your legs.
And your legs.
My leg?
We can cut this out.
This
We're
is
not
destroying
gonna-
all credibility of our guests. So if you made it an hour and 52 minutes, into
We
the
saw you
podcast-
clean the floor and your legs.
No. So let me
It's
tell
gonna
you.
take us on a
For
tour.
some
Here we
reason,
go.
I started to bleed on my leg mid cast, and I'm not sure why. Here we go. Wait, can you see that?
Hey.
Yikes.
Yeah.
Is that from hiking? Is that from
So-
hiking?
I don't know what I was trying to wipe it off, and then kind of peed on my pants a little bit, but I'm back now.
All right, let's get into Satan.
Here we go.
This is for all those Patreon. This is the extra
What a-
Patreon
Dude, I
hour.
actually just had this conversation with Jackson though. It's like sometimes and this did not happen just now. Like I tried to get it all out. Like I feel like I had a lot of liquids, but dude, sometimes you're having a good time. You don't want to miss out on the hangout. And what happens is when you're with a group of dudes, follow me here, and you gotta piss. Nobody wants to get up to piss. Because the second one guy gets up, then the other guy's like, it's kind of getting late.
Yeah, I
I
did
guess
start
I'm
that
gonna get
train.
going home. Well, yeah. Also, breaking the seal. Obviously, we got a lot of shit going on right here, so nobody's leaving. But you know what I mean? You don't want to bust up the hangout, so you hold it in. And then when you go, you're trying to make it quick as possible. And what do? You end up cutting it maybe a little short, and then you end up dribbling all over yourself.
Yeah. I mean,
But,
or,
I mean,
or
it's
in my
not-
case, try to multitask, wipe some blood off your leg while peeing,
It's pretty
and then
tough.
you
Yeah.
just, you got to accept the consequences of that.
You know this guy's nickname in college was Bobby P Pants. Not a joke.
That's Dr. P. Pants.
Dude, I think I'm gonna next time I'm peeing, I'm just gonna fake try and wipe my shin off while I'm peeing just to see how difficult that was. I just wanna run through that one time.
Yeah, I was thinking the next time I'm pissing my pants, I'm just gonna try to bleed as hard as I can. Does that make
Oh man, how do we transition to Satan from this?
I think it did it for us.
I think he's already entered the conversation.
Oh man.
God damn it.
All right, so when was your first foray into when did you first find out Satanist type things were going down? What was your sort of red pill into Satanism?
I don't know. I mean, I guess to relate it to the medical field is you'll have these patients come in and they're labeled as schizophrenic, hearing voices, telling them to do things, like seeing shadow figures, and we're just taught to believe that this is schizophrenia. I'm a pretty firm believer that there's possession, demonic possession, and I believe I've seen this several times from patients. And so,
Can you
of
give
course,
us kind
we
of
just load 'em
a
full
quick
of-
example? Can you give us an example real quick without
Yeah.
not too deep, but a quick example?
Outside of a wife being on her period.
What about the kid you told me about on the street when you were driving?
Oh man, yeah. So there's this kid. So I was just going down the street. Then I see this kid, probably in his 20s, on the sidewalk with his kind of hand raised up in the air and just blood trickling down his arm, a pretty significant amount. And he was just fixated on this bleeding, and I could see his lips saying something, almost like a chant. And no one, and so in the back of my mind I was like, well, this guy's probably trying to walk to the hospital or something. I'll just pull a U-turn and see if I can give him a lift, because no one else is, because this dude is pretty sketch. But I'm trying to be a good Samaritan. So I roll down my window. I'm like, hey dude, hey, you need some help? And then he just and when I pulled the U-turn and got next to him, I could hear him chanting something. It didn't sound like English. And then he just looks at me and flicks me off, just with pure evil. And then I was like, well, and then I just drove off. And so it's I don't know. It's things like that. Why would
I was
somebody
gonna
do
help
that?
you, dick. Yeah.
Yeah, so. I
All
don't
right,
know.
look,
and
man,
I've
I
been at
apologize for
parties-
that. I was having a bad day.
Yeah, and I don't know. I think demonic spirits can. It's a lot easier when you're intoxicated or blacked out. I mean, I've had. We used to throw a lot of house parties, and towards the end of the night, you could just tell that there was another entity in somebody's body, and just And I've had people like hiss at me and grind their teeth at me, and
Well, alcohol's like code. Well, it's a ghoul spirit if you actually break down the word, and so it is a demonic spirit. When you actually,
Yeah, go.
it's a ghoul. Yeah, it's a ghoul. If you look up ghoul, it'll say an evil spirit. Yeah, so
And spirits, alcohol.
Spirit, yeah,
are
wine
called
and spirits. Yep.
Yeah.
mm-hmm.
yeah.
But yeah, I don't doubt that, because like when you're drinking alcohol, I mean, you're on a lower frequency when you're drinking alcohol.
Right, you're more fun to be around.
So
I
and
mean,
so
you're
so
hilarious.
so there's definitely more opportunity for you to be possessed from
Right.
demonic entities and deities. Yeah, for sure.
They call it a social
so
lubricant, but look how many. If you
I wonder why alcohol
Overindulge.
is legal. Yeah.
right,
Yep.
Well, I mean, Jesus drank alcohol. Just all things in moderation would be my
Oh,
thought.
Jesus drank so much alcohol that if you drank his blood, it had the same alcohol content as wine. Am I right?
I mean,
Right? Jesus' blood is wine. No,
I'm like, yeah.
it's a fucking
I don't
joke.
know. I'm gonna ask Larry.
Made me drink the wine, man.
I think you'd be dead
Missed.
if that was the case.
I don't know.
yeah, if you weren't the son of God.
That's true.
Yeah.
So do you see it a lot in like patients that'll come in? So you don't handle like ER stuff, correct? Or do you
No, so I've spent 2 months in the ER. And yeah, sometimes like I had this patient get kicked out of her nursing home, because she was, I don't know, like hitting people or something like that, and I think she probably had schizophrenia, but I mean it's not something I see a whole lot, but just that's not even on the realm of a possibility in medicine. And the same goes for government, that it's just this country was founded, our government was founded on the belief that God is all powerful, and founded on his commandments and laws, but now it's just trying to do everything to distance and change that. And things were going great for 250 years.
Did you watch Fall of the Cabal? No.
No,
I mean that is, I don't know if there's a easy way to sum this up.
Like infiltration of
basically like demonic
That-
entities working through so like when you see people like Hillary Clinton, you say like, oh, how could she be so evil? And they say, well, she's just a puppet of like a satanic, she's
Right.
possessed, by
yeah.
a demon.
Who or what truly runs this world, or this realm, is like satanic forces, and like I think that's another thing that's just been commercialized too. Is
oh yeah,
just like it's.
normalized.
God, I don't, dude. I got like so many different thoughts, just like
Yep.
converging on each other, because that's what also what's just so backwards about this is that it seems like the same demographic that was targeted for like pushing, this goth bullshit and upside down crosses and fuck authority, fuck religion. Basically just everything your parents were into, throw that all out. Those are the same people now that are advocating for the government's orders, which I guess all makes sense.
Yeah.
Really, like all the people that were, rah, fuck authority and, like feeling like an outcast and everything. Those are the people that now all of a sudden have changed their position and are saying, no, trust the government. They have your best interest in mind, and none of it makes sense. And the people that now are being looked at as stupid and dangerous are working people, conservative, regular
people
working people. People trying to go to church, people trying to go to run their own fucking business, people trying to support businesses. Those are the enemy now. So this shit all actually makes sense. It's just so funny how it's gotten flipped. It's just bizarre. I don't understand it. And there's also I'll bring it up again, the cognitive dissonance in that if you did what the government wanted you to do and stayed home and just waited for them to give you a fucking check every month, where are you spending that check? Where are you getting the stuff that you need? There are people that are going to work every day to deliver you your bullshit. You know, there are still people that you're throwing into the fire, so to speak, sacrificing themselves, putting themselves in the danger zone for you. And again, you'd be amazed. Like, it's like fucking Christmas time right now at UPS because everybody's getting their checks. They got nowhere to spend their money because you can't really go out anywhere. Well, now things just opened up 2 days ago, but it was crazy. This week was insane, dude.
I think you look at like that $1,200 the government stimulus. It's basically no different than old time coal mine script, because basically they print this money that they use to already prop up the big businesses, and then they give it to you, so then you can give it back to the big businesses. So not only did they bail out the big businesses, but then they gave you money to pump back into those businesses.
That is
so it's all coming back to them.
That's also the projected or idea for the new UBI, right? Is like the $2,000 a month or whatever it is, but it would be digital currency or given on a debit card, so that you would only be able to allow to spend it. Am I making this shit up? By the way,
no,
I never verified
the federal cryptocurrency, and it wouldn't be based off of the dollar. It wouldn't, and it actually wouldn't even fluctuate with the dollar. They could make it fluctuate as they needed.
So it is. Coal miner's script. That's exactly what it is.
Yeah, and then they could, and just like coal miner's script, they could take it away from you if you're acting up, if you're acting a fool. So that's what they want. They want this UBI to basically control. If you control what the shit that people live on, and you could take it away at a moment's notice, they're going to fall in line with what you want. And then as they're getting rid of these small businesses and only the big corporations still exist, the ones that they've propped up, and you're just funneling money back into the man. It's no different than the coal miners. The coal miners getting paid and then putting the money right back into the people that paid them. It's the exact same thing.
Yeah, and I think I read that as of now, the stimulus, I think everybody, it amounts to $11,000 per person. Per person. You got a family of 5. That's $55,000.
I'm still waiting on mine. I haven't gotten a cent yet.
Same here.
Wait, what?
Same here.
Yeah,
I am an essential employee who has also had a business forced to close, and I am waiting on. I applied for the pandemic unemployment assistance, and I also am still waiting on the just standard stimulus.
They're just waiting for it to print.
I've gotten 0. Well, and that's the thing. It's like, I'm not fucking sitting here crying about it. It's like, let me get back to work. But then if I say that, I'm a piece of shit. Like, then I'm trying to kill everybody if I'm just trying to get on with things. I can understand a pandemic every here and there, but...
Ladies and gentlemen, you are hearing Jonathan Klug, the most fucked man in America right now.
Well, it's just funny. It's like, I got a foot in both camps, so I can say fuck you to both sides and also relate to both sides. So
dude, you're kind of a lonely wanderer right now. You could do whatever you want, man. You're like fucking Denzel Washington in Book of Eli.
That's a powerful person right there.
Yeah, you answer to no one right now.
That's right.
Ronin.
Yeah, you have gone full Ronin.
I do what I want, which is nothing, because I don't have any money or jobs. Yeah. But I did.
Got a belly full of Reese's Fun Size. What you got?
Yeah. I did enjoy a delicious, tiny, tiny, tiny Fun Size Reese's the other day. which is a whole nother conspiracy. But what the fuck is going on? It's not. This is the thing. It was the fun size Reese's. It wasn't the Reese's candy bar, and it was like you took one of the peanut butter cups and put it in a single. It was smaller. Why do they do that? Not the tiny ones.
Can
Can
I tell you a quick story?
Yeah.
Back when I worked for We Energies,
He's going deep.
it's such a bullshit company. They had this one year for a safety bonus. They gave us Culver's gift cards, but there was no dollar amount on it, right? So,
Wait, you got an unlimited card to Culver's?
well, yeah,
That's Wisconsin gold.
it was unlimited up to $3. Because we went into Culver's one night, and I ordered. I think I just got a shake, right? And I give her the gift card, and she goes, "This is for $3." She goes, "We don't even make $3 gift cards." So I got a fucking vanilla shake, and I owed 64 cents.
Yes.
That was kind of on par with what UPS did with the fucking fun size.
Because what I think is great is that I've just recently seen those advertisements for the Reese's with the M&Ms in them and shit, or the ones that you can get where you could either get more peanut butter or more chocolate. But no, they just went with the standard bullshit original fun size on you.
You want me to? Okay, this is the thing. It's like the guy they sent around he's a driver, so he's a union. He's a teamster, just like myself.
Company man.
Yeah, well, nicest guy you've ever met in your life.
That's
This dude, exactly. So I can't talk shit to this guy. I accepted it. I ate it right in front of him with a smile on my fat fucking face.
He was probably just looking at you like, yeah, eat that shit, you bitch.
He shoved it down my throat. He put his finger in my mouth and just. He was wearing gloves, by the way,
John,
so that he was productive.
You should have looked at him and said, "This is the first time I've eaten in 2 days."
This sure is delicious. You guys really care. Yeah.
Please, sir, may I have some more?
But they
More? Nobody asks for more.
But they also hung up some banners. They hung up some. There's a banner above the door. It says "Heroes Entrance." It's like fucking
Wow.
crooked
Dude,
as
they
hell.
blew the marketing budget on the banners. All they could afford was the fun sizers, man.
You didn't even
my
get to run
God.
through it like
Dude.
like a football team.
I got that sense.
I can only imagine it looked like the banner that they held up in Office Space. What did the Office Space banner say? Where they're like teamwork, they're like ripped down in it, like, oh yeah, Heroes Entrance. Wow, they did blow a wad on that.
It's rough. Yeah, we'll show you,
throw
Bob.
that up.
Yeah, we'll show you.
Yeah. Dude, I won't. I guess I won't say too much, but a close friend of.
That's big.
Yeah, it's a big banner.
You're a big.
Dude, speaking of big banners, like one more quick story just about people getting just completely fucked. Which a good friend of mine worked for Barnes and Noble for 12 years. I mean, I think bookstores, it's a rough business in this digital satanic age. But the dude
That's the truth.
with all this shit going on, like his store got closed, and he's in Illinois. Not that matters, but store gets closed. But he was it was like a 2-minute phone call that he got aced, just super cold, just like 12 years with a company, and then like basically a phone call, you're fired, just pure bullshit. I mean, it's just terrible. Nobody deserves to be treated that way. And so I got the word that happened, and I called him up right away and talking to him for a while, and then and he was pissed with, of course, why wouldn't you be? He's like, you know what the worst part is though? Worst part is that because he was a store manager, he's like, they sent me the box of materials to put up the going out of business signs. Or not going out of business, like the store closed signs. They sent me the box I've lost my job. I'm supposed to go back there and hang up these fucking signs, and the invoice was in the box. It was $3,000 worth of marketing materials to let people know that the store closed. What the fuck? These people are monsters.
Allow me to laugh at that, but that is.
It's terrible. Well, he was laughing at dude. Great dude.
He's such a good guy. Yeah, he's such.
Yeah, he was just like, what?
That's so
what
fucked up.
Like, are you kidding me? Like, because along with that, you're supposed to get for every year you're there, you're supposed to get like so much of a severance or whatever. Well, that was Ace too. But they had the money in the budget for the marketing materials to let people know that the store was closed. Also, important to notate that all stores are closed right now. So the signs saying the store is closed really were a bit redundant, as all stores are currently closed.
So, Bobby, do you ever get like, so when when you guys are standing on top of the parking structure waiting for your flyover, and then you hear about a guy getting canned of 12 years working hard at a job, does it ever, like, how torn must that make you feel? Is that do you think about that at all, or?
Yeah, I mean, and that's why I'm when I'm done with the residency, I'm not gonna be part of the matrix. I'm gonna capitalism at its finest. I can't be part of a failed system that does not care for people, and that's the truth. You're almost viewed as just an entity, and there's no human connection to it, and it's sad. And I was unrelated, but I was thinking the XFL had the opportunity to be America's, like, it could have been the biggest thing ever, the one sporting like thing going on, and
Holy
initially
shit.
when the XFL first came out, advertised as like WWE players playing football, like they could have lived up to their own hype and really done something special. And I'm just disappointed that they
Bobby, you
didn't
are
have the courage.
seriously onto something, because check this shit out. Not only the XFL, because I hear you, like, the XFL totally got blasted on this whole thing. They didn't stand a chance. Not only did Donald Trump participate in the WWE, but Donald Trump was the one that started the USFL, right? Way back in the day, or the
Might have been an investor. I don't know if
I think he was an investor.
He had a
I'm
deep
sure
connection with it.
Sure.
So could this COVID-19, the real reason would be to shut down the XFL?
Oh my God!
Hot take.
I don't doubt it. I don't doubt it.
That's real.
And mission accomplished.
Wow. Because
So-
that did shut down right at the height of, what was that quarterback's name who was just fucking basically the XFL Patty Mahomes, just going off. What was that one guy's name?
I don't know, Cardale or like
No, that wasn't
one-
Cardale. It was the other guy, the little known guy, like
the Hawaiian guy.
I don't remember his name, but he was going off and he was like just living that life.
I think where Bobby was going with this is, if they would have just held firm and not shut down the season and just said, F COVID, we're staying open. Dude, yep, that would have been
It could have
all
That'd have been a
people would
McMahon
watch.
move.
Oh.
That'd have been a McMahon move of all McMahon moves, dude.
Look at
I
this.
mean, they're already bankrupt. Like, they didn't have anything to lose but to cave to the man.
Why do we all just got to cave to the man?
Just imagine if the XFL pushed through, like, no matter what. Like, if dudes went down with the disease, they'd throw that fucker on a ventilator and just have a team of nurses, aka heroes, pushing him down. Like, like they'd have like a fucking fishing net, just like sticking out of the hospital bed, and you just like throw it in there and then you march it down the thing. These are just ideas.
It'd have been like NFL, basically like NFL Blitz. Yeah. Like just fucking get that cortisone shot in them and get them the fuck back out there.
Yeah,
Like, just owned it. Just if they would have just owned it.
dude, possibilities.
I mean,
were endless.
but I mean, in all seriousness, if some big entity like that was to stand up and have the courage to do it, put it all on the line, you know, now we would know that probably. And I mean, I just listened to Elon Musk, 7,000 employees, nobody's died. Nobody would in the XFL would have died. Maybe a couple people would have got COVID. They would have been fine, and just be a public display that this is not an issue.
Dude, they could have had a serious. They could have been hero status. That's coming from a hero. Bobby, you're with me on this one. I know that.
Game recognized game.
Yeah. Yeah, real recognizes real in this case. But you are right. If that's where you were going with this, absolutely. That would have been the only fucking thing on TV to watch. Why wouldn't you? I mean, so what if no one's in this? Nobody's in the stands anyways. And you know, the other thing is, if nobody was going to be in the stands and you still did the game, you should just like take it like play in the street or something. You know what I mean? Like play it like in like a park. Like play like NFL Street. Remember that game? Play on like a tennis court. You know, like we're gonna play. We're just gonna play here. There's no fans allowed. Make it like a cage match scenario. Do something like that where there's no fans anyways. I mean, have some fun with it. But that is where the XFL, we've talked about this already, that's where the XFL fucked up from the beginning, is like, they had the weakest uniforms, the lamest team names. I mean, they were just looking like default Madden, teams. If you're like, yeah, I want to build my own team, but I'll probably figure out all the shit tomorrow. I just want to play. Just get my... It's like you're the Barcelona Dragons. Like, so that's kind of sick.
Not to piss in your Cheerios about the hero story of. No, I'm serious. But
Don't you mean Fruit Loops?
You've been hearing stories about the government. So a lot of restaurants and bars, they're saying, yeah, you can. I mean, even here in Wisconsin, it's kind of like, yeah, you can go ahead and open up your business, but good luck renewing your liquor license next year, or good luck with this, good luck with that. And they're out in L.A., there's any business that's defiant, they're being told that their water and power is being shut off. I don't know if you guys seen that.
Wow.
So it's kind of, it goes back to the government always having, and us giving into the fact that people aren't defiant enough to say, the government always has the upper hand if you let them, with the licensing, like with what you got going on, John.
That was the whole threat to my industry, I guess, and my wife's. So both of us at the same time. You know, she was doing hair, and I do tattoos, and on the same day, those are both ordered to close, and both of those you need a license for both of those, and then myself, I needed an establishment license because I own a shop, and that was the whole thing. It's like, not that I would do it, it's not worth just causing the mess or fines or whatever, like I said, this came on kind of slow, so you play ball, I'm not going to just like, I had people fucking texting me like, "Are you doing like house parties?" It's like, yeah. So, which only tells me that, oh, okay, there's other people out there that aren't super scared of whatever is going on, but you're not going to do that. But let me tell you real quick, like, I know I'm probably going off on a tangent here, but what's so funny is that I need to apply for a license for myself. I need to apply for a license for my establishment. The word wasn't handed down to me through an email, through these entities that I have to go back and forth with to get said license. I didn't get anything from them directly telling me that I had to close or what was going on or anything like that. I had to hear it from a news article. And now same with reopening. I didn't get anything from them. I didn't, about the reopening or regulations or anything like that. But I still got the email that my licenses were both up for renewal, and those are due June 30th. So great timing when you haven't worked for a couple months and now you need to re-up on all your fucking licenses and my insurance and everything else. So,
well, before this whole COVID thing, it's like you could look at the licensing as, I'm sure maybe you probably even looked at it as, well, it's just a way for the government to get a fee, extra tax money.
Well, yeah, because it was basically a straight up fee. You pay the fee.
Yeah.
They send you your
Even me
license.
with my yearly LLC fee and stuff like that. But now
LLC.
Yeah, I think now you kind of see it for what it is. It's like, well, it's more than just a fee. It's total control because
if they pull that, you're fucked.
Well,
Which now it's a threat that they have on you in the case of something like this. Yeah.
My wife used to do hair, and she had to be licensed, and even with doing tattoos and stuff, it's like, why, if you're good enough at what you do, if you have customers that keep coming back and you have a reputable shop, why do you got to be licensed? Why do you have to get a license from the government? Like with my wife doing hair, why does she have to be licensed?
Right.
You know what I mean? If everybody that was going to her to get their hair cut was coming up with head lice, she wouldn't have a business.
Yeah.
You know what I'm saying? So why does the government have? It's just a way of them controlling you.
That is right, and that's free market capitalism.
Which
I'm all about, like libertarian. Yeah, dude. Fuck yeah, yeah.
A good friend of mine wrote a book. Well, I don't call it a book so much as a manifesto that explains a lot of that. His name was Theodore Kaczynski. And he does actually call out a lot of that and a lot of that government control. And so, yeah, if you're looking for something to read, the manifesto is
some light bathroom reading. So,
Yeah.
Bobby, what would your opinion be in the medical industry as far as like a free market capitalist, from a free market capitalist point of view? Good thing, bad thing? Take the insurance companies out of it?
Oh, 100% a good thing. Yeah. Insurance companies, they don't care about their patients at all. Zero. Because you've removed the humanistic component of it. The insurance company's not sitting there in front of their face saying, we're not going to pay for this medicine that will save your life because of X, Y, and Z. All they have to do is just say we're not going to do it, and then their hands are clean. And so just kind of more broad, like as far as solutions to all these issues, that's where I try to put most of my thought into. How are we gonna fix what's going on? And I don't know if you guys have talked about it, but the Article 5 of the Constitution, the Convention of the States. Do you guys know about that?
I know about it.
Yeah, Evan and
yeah,
Dustin
me too. Yeah, me too.
probably know
Why don't you
about
just
it.
tell for everybody else? Yeah.
Yeah. So for all those podcasters out there, basically, the founding fathers were smart enough to realize that the federal government will get power hungry, and that currently, it's both parties. It's Republicans, it's conservatives. That it's human nature that if you have power, you want to keep it, and that's the fact. So in Article 5, if you have 2/3 of the states that basically put forward legislation saying, we want to have a convention of the states for these reasons, then that will happen. They all meet and they agree upon and right now the three unifying things is limit terms, balance the federal budget, and I forget the third one. But then they all meet, they come up with, the legal document, and then it has to be approved by, is it 2/3 of the states?
Yeah, I think
Or
it's
3/4?
It might be.
Any
It might be
amendment? Is it 3/4?
Might be 3/4. It's tough to do,
Yeah.
but it's a way of circumventing Congress, and it's a way to bring power back to the states. I don't think it's ever been used, but it's in the Constitution.
Yeah.
Yeah, I mean it's kind of like the last resort. Once the
Yeah.
Fed
And-
gets too powerful, this is a way for the states to pump the brakes and bring things back to the people.
Right, and that is what the Libertarian Party is rallying for, right? I mean, it's God, I always forget that guy's fucking name. That's
Ron
Mark
Paul?
Meckler?
no, no. But this dude basically wants to the Libertarian Party. Hold on.
Wait, Yao or the guy that was on Rogan?
So do you think that? Do you want more? Do you want to see more power to the individual states, Bobby?
Adam Kokesh.
I want to see more power to the people.
Well,
I mean,
sure.
that's
Agreed.
that's the fact of it.
Right,
and-
but
and-
a more by way of a more local government. So it's Adam Kokesh
Right.
is the dude that his if he won the presidency would be to basically disassemble the federal government and delegate away most jobs, put most of the power back into the states, which would then it should be a trickle down that your immediate local government would have more power and more effect on what actually happens in your community, which is the way it should be. Our way of thinking, though, is that it is the exact opposite. The only time people go and vote is for president, when really you should be voting for
Yeah, we
like
touched on
fucking
this.
district aldermans and shit like
We
that.
touched on this a couple weeks ago when Zach dropped the bombs on us, saying that basically one of the most important elections you have is for your local sheriff,
Right.
because they're your first
Yeah.
line of
I
defense.
remember
Right.
that, Bob.
Yeah, and look at what's happened with the sheriffs during this whole fucking thing.
Yeah,
You
they've
know,
been
it's
stepping.
the
A lot of them have been
sheriffs,
stepping
yeah.
up and saying, "Hey, we're not gonna
Go
we're
ahead
not
and
gonna
pass
do this."
whatever you want, but we're not going
Right.
to enforce your bullshit. Yeah.
Right. Yeah, I've thought about
Yeah.
that a lot since Zach brought that. I was like, damn, I never really thought about that, and it's proven true right now.
We're going Zach Hensey,
Yeah.
Bobby Ice, Sheriff, 2020.
Yeah. Duh. Yeah.
So
American Sheriff.
Ice, how does this convention of the states relate to insurance and the the medical industry?
Ooh.
I feel like that's where we were going, and then we
Yeah, I mean, I think it comes down to, hopefully at some point you'll have this distinction between a terrible state and a good state, or and you'll have options. You can move, and that's why I think it's very, very vital that the federal government does not bail out states, because through and just this whole bailout in general, I think is just it's just if you have a company that does not have savings or did not prepare, I know it's a pandemic, blah blah blah, but through failure comes growth. As a company, as a human, that's how we get better. And ultimately it's gonna end up with the federal government failing, as we clearly can see.
I think I also thought one of the things that they brought up was competition, basically over state lines for medical. You know what I mean?
Bidding against each other.
Well, listing your prices, and with me, I live right on the state line, so if the price is better in Illinois, I'll reluctantly go to seek health care down there, or
Yeah.
basically whoever has the better price. But
Yeah, and I think there needs to be insurance needs to just totally change. I mean, I don't think
Is that even
employers
possible?
should be offering insurance anymore. I mean, initially, and I forget where I heard this, but there is a federal law where it basically like capped. It forced companies to offer benefits, and a great benefit would be insurance. And it needs to be, you have these health sharing ministries now where it's not insurance, it's just a collection of people that have the same morals that agree to cover each other's bills. And
a lot like tuition.
And we, that's I think I got to come back because I got, the
Bobby, you got an
indoctrination.
open invite at all times, son.
Yeah. As long as, yeah.
Sorry.
As
Go
long
on.
as you keep that bathroom door open, you are welcome back anytime.
You keep bleeding, you keep pissing, and we are good to go, baby.
Well, and I just found out that I'm bleeding on the other side of my leg.
Dude, God,
So we got
damn, what is wrong with this guy? He's gonna lose a leg. At least it's the same leg.
Got the Kawasaki disease.
We call him Bobby Open Wounds.
Bobby, put some ice on there.
So is there a solution to the insurance trap, Bobby?
Call him Bobby Rice.
Yeah.
Rest.
So here's
ice.
here's the solution. Is you first, for primary care, you join a doctor that actually wants to care for you and save you money, which caring for you includes not ripping you off.
So would that be one of the direct primary care doctors you're talking about?
Correct. And they're almost in every city now, so you can just easily look that up. But and just exit the insurance industry.
But what happens if I fall off a roof and break my back and it's $250,000?
So joining, you want to exit the insurance industry, and as of right now, the best option would be to get on board with a health sharing ministry. Most of them are Christian based, but there's some that aren't. And basically, it's you go up, so you break your back. You go into the hospital and you say, I'm self-pay. I'm paying cash. And then automatically your bill is going to be about half. And then after that, I mean, it's a lot more work, but it's it's how we're going to break the system. It's how we're going to make it fail.
Bobby, I was teeing you up with this because that's where I'm at right now as a piece of shit small business owner that can't afford real insurance. We've joined a health cost sharing network, and it's exactly as you explained, about 50% off the listed price when you're paying cash. But yeah, you submit your receipts to the health share and you basically get a check for it minus whatever they call the deductible, which is way less than insurance. But yes, it is way more work, and it puts a lot more responsibility on the consumer. Because you see how much things cost, and it makes you question what you're doing.
Yeah, and it makes the hospitals accountable. It makes it doesn't muddy insurance is all about muddying the picture and making everything as unclear as it can, so they can rip you off. That's the bottom line.
Well, and that's for myself. Also being a piece of shit business owner and being treated like a piece of shit working for a giant ass company to for them to, and I have great insurance. My insurance is insane, and that's where I what you were saying before. That's where I likened it to, like basically like a free ride scholarship, is because who says that this is worth this? Like, so our insurance is worth this much. Like, this is what our union fights for us to have this insurance, and we have such great insurance. And it really, if you broke it down, this is how much you would be paying. Because I mean,
yeah, because they like to say, well, we're not going to pay you as much up front because your benefits are included.
right?
But your benefits are inflated because
Inflated
it costs so
as
much damn
fuck.
money because of the insurance company, the middleman.
Right.
Yeah.
It's crazy.
And also, you got to realize that your insurance is also paying the hospital, who is caring for. And I read this stat at some point, but like something like 95% of medical bills all over is by like 5% of people, and those 5% of people, I mean, from you. So to give you an example, there was this alcoholic that liked to come in and fake withdrawal seizures. He wanted his Ativan, and so he'd come in and like he had the whole body shakes, and you could tell like he was pretty good at it. But he would come back about every week or so, same story, like I'm going to rehab, and this I think this is probably like the 7th time that he came back that I saw him. But I mean, that's just a small. You have all these drug users that get abscesses that, they're in the hospital for 1 month getting IV antibiotics, and then they'll leave before the course is finished. Go inject their heroin, come back, same story. That's why the system is part of the reason is because that's acceptable. There's no one saying like, what the hell is wrong with you? If your kid kept I don't know, doing drugs and asking for money, at some point you're going to stop giving them money. But that doesn't exist in healthcare.
Isn't another part of it that a lot of people that are on Medicare, doesn't Medicare pay like 12 to 17% of...
Oh yeah. They don't pay anything. Like they'll come into the ER with a cough. There's no personal skin in the game, which is a huge problem.
Right, and the more people that are on Medicare and the hospitals having to make that cost up elsewhere, it's being charged to the
they're getting
insurance
it from
companies.
people that are responsible, work, and pay their bills.
Which is something that Brett brought up on the last podcast, is basically if you're responsible nowadays, you just get schlonged hardcore.
Yeah. That's what it feels like.
Yeah, and I think as a culture, we've fat is beautiful. There's
There's a fat chick on the cover of SI, man. The swimsuit cover.
Hey, that's beautiful. How dare you?
I bet she's afraid of COVID.
Well, that's it.
There's growth
Trigger
through
warning.
suffering. There's you can make personal growth through suffering, but we've.
But
And-
okay,
and
we've
I
all
know
fucking seen it though at the grocery stores. That's what's so disgusting too. Is like there's a big time disconnect in your. This is when you're just being force fed bullshit and buying it like hardcore. Is the people who are visibly in poor health still buying their Wild Cherry Pepsi 24-ounce 18 packs, wearing a mask and gloves. Meanwhile, they're probably 200 pounds overweight, and and buying fucking frozen pizzas and whatever else. Like,
Oh yeah.
Like, I just wait for the fucking vaccine. I'm good.
But they're getting the check. Those are the ones that are getting the checks from the government. So they're like, stay
And
stay at home.
Their checks arrived on week 1.
yeah, but hey, but it's an education problem. They're just not educated. That's what you hear.
So I know we're pert near 3 hours into this, and I don't mean but I want to know what, because this kind of goes along the lines of what we're talking about right now. How do you feel about like holistic medicine and not prescribing drugs, but just prescribing a healthy regimen? What do you think about that versus like actual wellness versus medicine?
Can I add something in there real quick along with the
question.
holistic?
Yeah.
What about going along with the holistic stuff? What do you think about medical marijuana?
So
So
AB question. Your answer for
I'll
A?
start with the first, and then we'll go on to medical marijuana. But holistic. So I think there's in medicine now that almost like teaching about diet and weight loss is just first of all, you have to build a relationship with your patients, and the most important thing to do that is time. You can't go and tell somebody to totally change their life and have them believe you and actually do it by spending 10 minutes with them, maybe 2 times. That's totally unrealistic. And because there's been this shift where those things are almost like laughed at, like, oh, you have diabetes, we're going to start off with changing your diet and you're going to need to exercise every day. And now I'm going to try to explain diabetes in 2 minutes so you'll believe me. And then the opposite of that is, here's a medicine that's going to, lower your blood sugar while you continue to do what you're doing. And then once you get worse enough, we'll start you on insulin. It's just a backwards. Instead of changing the root of the problem, we're just putting Band-Aids on it, and that's across the board.
Right. That goes back to the fucking Suboxone shit too. I mean,
You're treating the symptom, not the cause.
right.
Right, and it to take this a step deeper is good and evil. You have to actually care and love for people to make things better, and that's unfortunately just not what's happening. That's the truth.
Preach, man. That's preach. That's real deal, dude. That's real.
Yeah. This.
And I mean, honestly, it comes down to, as a culture, as an individual, every day, making the conscious decision to have the courage, to go against the grain and to stand up and to love your neighbor. You got this guy that's coming in the ER injecting heroin every other weekend. Nobody addresses the problem. Nobody, it's just, oh, you have an infection. Here's some antibiotics. Go do your thing. That's not what we were created to do. We're and that's why I keep bringing this back to good and evil. We are a fallen world, and we need to be the good, the light, and that's how this country is going to change, instead of just putting Band-Aids on the problem and just avoiding it.
Yeah, I mean, Dr. Bobby. Your brother, what?
Or just some guy that he knows.
Some guy I know that knows you. is great, dude. Probably one of my best friends. I've met your parents. You guys are good people.
Just a couple other people that we know.
I've met your sister. She's okay. I'm just kidding.
She's kind of ornery right now. I don't know
But
why.
I know the cloth you're cut from. Do you feel, because everybody's out here too, we're kind of, or at least within a certain vicinity. Do you feel a little isolated out there? Are you finding like-minded people in your industry now, or are you now, 2 years into this industry, just like, holy shit, or do you see some hope? We're still looking for the good stuff.
Yeah. I see some hope, but it's more of me kind of bringing up these things, and then people being like, oh, like, yeah, like, that's fucked up. But and so people, I think inherently people are good and moral, and they see a system that is not, but they almost need somebody to have the courage to stand up and let them know. And that's what I feel like as a nation we're almost at, where we realize that things are very wrong. And I think this whole COVID thing has almost brought that to light, where this is an opportunity to be a tipping point where people will see things for what they are and then actually do something about it. At least, that's what I hope. But
right,
we'll see.
Yeah, you would hope that this is a good magnifying glass on that we're being fed some bullshit on a regular basis. There is corruption and hypocrisy and an agenda and propaganda that's being shoved down our throat. Now, would you stop avoiding the question? Zach wants to know what you think about legal pot.
Oh, legal
AKA
pot.
the devil's lettuce. Go ahead.
Yeah, I mean, so there's like synthetic pot that is legal that we can prescribe, but
He's talking about Special K?
Oh.
I forget the name of it. I've never prescribed it, but I don't know, aches and pains. Yeah, I think it has a purpose. But as far as legalizing it for everybody, I'm not. So I got.
And what if he does a little bit of cocaine on top of
weed.
it? Oh, okay.
Well, I got a federal driver's license, so I need some medical professionals to kind of stand behind a federal legalization here. So that's what I'm asking.
Federal legals. So, I don't know. My thoughts on it are there. I think there's proof that weed can lead to schizophrenia in minor. I mean, it's people don't die from weed. And I guess it should be your right to do that. I mean, we're giving people opiates. We're giving, and that's legal, So I think it's fine, but as a personal choice, I'm not sure how much good can come from it. Would be my thoughts, but legalize it, I'm fine with that.
Yeah, you would definitely agree that it affects different people in different ways, right? I mean,
right.
I would attest to that.
Oh, yeah. Yep.
I mean,
Jackson, don't be so quick to agree with me, son. All right. What are you talking about?
So you're basically saying that the cons don't outweigh the pros, right? It maybe even, or maybe more pros than cons. Or...
No, I mean I'd say more con in the grand scheme of things. Is it helping you help people?
Meltdown.
You had us at libtards. You lost us at weed is bad.
And this interview is over.
I think Marshawn Lynch said it best to sum it up. Take care of y'all mentals. Take care of your body. Take care of your chicken.
Get your chickens.
think we could probably call it there. Huh? Yeah.
Yeah, I think on Marshawn, I think we're good.
Dude, thank you.
Dude, you
so
crushed it,
much.
man.
Yeah.
Bobby Ice.
Bobby
Fucking Bobby Ice, man.
Doctor. He is Dr. Bobby
Dr.
Ice.
Bobby Ice. He wears a Jesus piece for a stethoscope. He bleeds all over the place.
He's
From both legs.
He is
while
constantly
pissing.
bleeding. Yeah.
Dude, seriously, brother, man. You got to pass anytime. You call us and we will assemble to talk to you at any moment.
Oh, yeah, man. In
Sounds
person
good.
would be preferable. So
Yeah.
Next time you're up around these parts, let's get together.
We'll put down some plastic
Yeah.
for you.
Yeah.
Yeah. No, I'm thank you so much for having me. I'm excited for round 2. So
Yeah.
stay tuned.
No, man. Yeah, we'll set it up. Cool. All right, man. Well, thank you so much, dude. I guess we'll say bye for now, but we'll talk to you real soon. We'll keep
All
this.
right,
We'll
sounds
keep the
good.
chat going too.
Yeah.
We're all in the same chat, so we got that going.
Right, yeah.
Cool.
Nice.
All right, man.
Jackson, you gonna send us out?
Oh
No, dude, that was a great send out. That was a great send out on the Marshawn.
Oh, we forgot to trigger Brandon too.
Oh man. Next time, round 2.
Dude, we gotta have Bobby.
yeah.
We gotta have Bobby trigger Brandon once. Bobby, you've listened to the podcast. You know my brother is as straight laced as they come. So basically, say anything to trigger Brandon Lamp.
I think all,
All right,
the lips.
Brandon Lamp. You're about to be triggered.
Trigger.
Wait, you gotta trigger him.
You
Yeah.
gotta trigger. Well, let's just say. I mean, you called him a libtard earlier, so let's just say that he's triggered.
Just getting called out.
Actually, no, to be
that'll
honest-
trigger somebody.
To be honest,
I'll
dude,
just take that clip and I'll put it at the beginning.
dude,
of the episode.
I'm gonna because
that'd
dude,
be
because
great.
this was a 3-hour Brandon Lamp trigger because he was a biochemist and he wanted to be a doctor originally, and to hear you talk about
That's
shit,
the
dude, he's gonna be triggered for 3 fucking hours.
He didn't
So,
have the
yeah, so-
balls.
So yeah, cut that clip at the Brandon Lamp. You're about to be triggered, and then about to put Brandon.
Oh,
All right, this is
All right.
take some editing.
Yeah. Yeah. Just so we're all clear, I'm keeping all this shit in there. I'm just taking that clip, putting it at the beginning.
Hey,
Got it,
we're
yeah.
breaking down the 4th wall here.
Yeah. Shit. All right, man. Good night. We'll talk to you. We'll talk to you soon.
Thanks for having me.
Yeah. All right.